The blood hit the floor before anyone saw the knife. A man in tactical gear collapsed in the ER hallway, choking on his own breath, vital signs crashing, airways compromised, doctors frozen in the chaos. Then a voice cut through the noise like a scalpel. Step back. Not loud, not harsh, just absolute. A pale nurse with tired eyes and faded scrubs pushed past 3 senior physicians, dropped to her knees, and tilted the man's jaw with surgical precision. Her fingers moved like she'd done this 1,000 times in places no hospital manual could prepare you for. The monitor beeped once, twice, then stabilized. Every doctor in that hallway stared at her like she'd just raised the dead. No one knew her name yet, but they would. Because Clare Whitaker wasn't just a nurse. She was something the hospital had never seen coming. And the people who tried to bury her? They were about to find out what happens when you corner someone trained to survive wars. If you want to see how far a quiet voice can shake an entire system, stay with me until the end. Drop a comment with your city so I can see how far this story travels. Let's go. Silverline General Hospital smelled like disinfectant and overconfidence. The kind of place where doctors wore their credentials like armor and nurses learned early to keep their heads down. The building itself was newer than most. Glass facades, digital boards in every hallway, administrative offices that looked more like corporate suites than medical facilities. It had the polish of a place that cared about rankings and reputations, about how things looked from the outside. What happened behind closed doors was a different story. Clare Whitaker walked through the automatic doors on a Tuesday morning, badge clipped to her pocket, hair pulled back in a simple knot. She looked like every other mid-shift hire, unremarkable, replaceable, easy to ignore. Her scrubs were standard issue blue, slightly faded, like she'd bought them secondhand or worn them too many times. She carried a small backpack with a water bottle and a protein bar visible through the open zipper. No coffee cup, no phone in her hand, just walking, steady and purposeful, like someone who knew exactly where she was going, even if no one else cared. Doctor. Ethan Cole noticed her the way you notice furniture. She was assigned to his rotation in the ER, which meant paperwork, vitals, and staying out of the way when real decisions needed to be made. He didn't bother learning her last name. There were always new faces cycling through, most of them gone within 6 months. The ER chewed people up, long hours, verbal abuse from patients and doctors alike, the constant weight of life and death without any of the glory. Nurses quit. They burned out. They transferred to quieter floors where the work was predictable and the stakes were lower. Claire didn't introduce herself. She just nodded when the charge nurse pointed her to a station and started organizing supply trays with the kind of focus that made people uncomfortable. She checked expiration dates on medication vials, straightened IV lines, realigned the crash cart so everything was at perfect right angles. Her hands moved with a strange economy of motion. No wasted movement, no hesitation, like she was following a checklist that existed only in her head. "You worked trauma before?" the charge nurse asked, more out of obligation than interest. Her name was Diane, a 20-year veteran with a voice that could cut through a code blue and a patience level that had long since flatlined. "Yeah," Claire said. She didn't look up from the tray she was organizing. Diane waited for more. Most new hires loved to talk about their experience, their training, the hospitals they'd worked at before. It was a way to establish credibility, to prove you belonged. Claire just kept sorting supplies. "Where?" Diane asked. "Different places." "Like where?" Claire glanced at her, expression neutral. "Around." Diane's eyebrow went up. Weird maybe, but harmless. She shrugged and moved on, already forgetting the conversation before she reached the next station. For 3 weeks, Claire was invisible. She took vitals. She prepped IVs. She restocked crash carts and cleaned up after codes without being asked. She worked the overnight shifts that no one else wanted, the ones that stretched from 11 at night to 7 in the morning, when the ER was a mix of drunks, overdoses, and the kind of emergencies that happened when the world went dark. She never complained, never asked for a better schedule, never mentioned being tired, even when her eyes had that hollow look that came from too many nights without real sleep. Patients liked her. She had a way of talking that made panic dissolve, a steady voice that didn't promise miracles but made you believe you'd get through the next 5 minutes. An elderly woman came in once, mid-panic attack, convinced she was dying. The residents tried reasoning with her, explaining that her vitals were stable. that it was anxiety, not a heart attack. She didn't hear them. She just kept gasping, clutching her chest, eyes wide with terror. Claire sat down beside her. Didn't say much at first, just held her hand, matched her breathing, slowed it down degree by degree. "You're okay," she said quietly. "I know it doesn't feel like it, but you're okay. Breathe with me. In. Out. That's it. Again." 5 minutes later, the woman was calm. 10 minutes later, she was laughing, embarrassed, apologizing for wasting everyone's time. Claire just smiled, small, brief, and told her it wasn't a waste. The staff barely noticed. Claire didn't eat lunch in the break room, didn't gossip by the nurses' station, didn't complain about difficult doctors or impossible shifts. She kept to herself in a way that felt intentional, like she'd built walls and had no interest in taking them down. Some of the other nurses thought she was stuck up. Others figured she was just shy. A few wondered if she was running from something. No one asked. Dr. Ethan Cole saw her once during rounds, kneeling beside an elderly man who'd come in with chest pain. The man was gripping her hand, eyes wet, breathing shallow. He was talking, rambling really, about his wife, about how she'd died 2 years ago, and he still set a place for her at the table. Claire wasn't saying much, just holding his hand, listening. Her face was soft in a way Cole hadn't seen before, like she actually cared about the story, about the man, about the fact that he was alone and scared and needed someone to hear him. Cole glanced at the chart. Stable vitals, nothing urgent. He moved on without a word. Soft touch, he thought. Probably got into nursing because she liked feeling helpful. That type never lasted in the ER. They transferred to pediatrics or outpatient clinics, places where the work was gentler and the patient said thank you. Cole had been at Silverline for 6 years. He was good at his job, fast, decisive, confident in a way that made residents want to impress him and nurses want to avoid him. He didn't yell, not usually, but he had a way of making people feel small with a look, a sigh, a carefully chosen silence. He believed in hierarchy. Doctors made the calls, nurses followed orders. That was how hospitals worked. That was how patients survived. He didn't think much about Claire. She was competent enough, quiet enough, unremarkable enough, just another face in the rotation. Then came the night everything shifted. It started with a radio call, multi-vehicle pile-up on the interstate, 15 minutes out, at least 8 critical. The ER lit up. Nurses cleared beds, wheeled out gurneys, prepped intubation kits and transfusion setups. Residents scrambled, pulling on gloves, reviewing trauma protocols in their heads. Cole barked orders, adrenaline sharpening his edge. He loved this part. Controlled chaos, life and death on a timer, everyone looking to him for the call. He was good at it. He knew he was good at it. The first ambulance arrived with sirens still wailing. The paramedics were already shouting vitals before the doors opened. A woman in her 30s, unconscious, chest crushed by the steering column. Her face was pale, lips tinged blue. Paramedics were bagging her, squeezing oxygen into her lungs manually, but her saturation levels were tanking, 78%, 75%, dropping. Cole took one look and started running the code. "Get her on the table, someone bag her. I need an airway kit, move." His voice cut through the noise, sharp and sure. Residents jumped. Nurses moved. The woman was transferred to the trauma bay, monitors beeping, alarms starting to scream. Cole grabbed the laryngoscope, tilted her head back, tried to visualize the vocal cords. Nothing. Her airway was swollen, maybe from the impact, maybe from aspiration. He tried again, adjusting the angle. Still nothing. "Reposition," he snapped. A resident adjusted her head. Cole tried again. The tube wouldn't pass. "Suction," he said. A nurse handed him the catheter. He cleared her airway, tried again. Same result. The monitor was screaming now. Oxygen saturation at 70%. 68. Her heart rate was climbing, her body fighting for air it couldn't get. "Again," Cole said, voice tight. Sweat was starting to bead on his forehead. He could feel the room watching him, waiting for the call, waiting for him to fix it. Then Claire was there. She didn't ask permission. She didn't announce herself. She just stepped in, nudged the resident aside with her shoulder, and tilted the woman's head at an angle Cole hadn't considered. Her fingers moved to the woman's neck, feeling for landmarks he'd skipped in his rush. She found the cricothyroid membrane in 2 seconds flat. Cricket, she said. Not to anyone in particular. Just said it, voice flat and certain. A nurse hesitated, looked at Cole. He was staring at Claire, caught between anger and confusion. Now, Claire said. The nurse handed it over. Claire didn't wait for approval. She prepped the site with a speed that looked reckless, but wasn't. Made the incision with a scalpel that moved like an extension of her hand. Clean, fast, no hesitation. The blade went in. The tube followed. Air hissed into the woman's lungs. The monitor's rhythm steadied. Oxygen saturation started climbing. 72, 76, 80. Cole stared. The woman was breathing. Claire stepped back, pulling off her gloves, wiping her hands on her scrubs like she'd just finished restocking supplies. She's stable, she said quietly. Then she walked to the next gurney like nothing had happened. The ER kept spinning. More ambulances, more patients, more blood. A teenage boy with a fractured skull seizing on the gurney. An older man with a steering wheel embedded in his ribcage. A young woman with a severed radial artery, blood pooling faster than anyone could clamp it. The room was a hurricane of noise, alarms, shouting, the wet sounds of trauma, the mechanical rhythm of ventilators and compressions. And every time the room started to fracture, Claire was there. Not loud, not showy, just exactly where she needed to be. The teenage boy seized again. Claire was beside him before the resident finished calling for Ativan. She had the dose ready, the IV line flushed, the medication in his system before the doctor finished his order. The boy's convulsions slowed, then stopped. His breathing evened out. The older man with the chest injury started to decompensate. His blood pressure was dropping, his lung collapsing under the pressure of internal bleeding. Claire saw it before the monitor did. Pneumothorax, she said, already pulling a chest tube kit. A senior resident looked at her like she was insane. We don't know that yet. Left side, Claire said. You've got 2 minutes before he codes. The resident hesitated. Cole was across the room managing another patient. The resident made the call, followed Claire's lead, inserted the tube. Air and blood rushed out. The man's pressure stabilized. The young woman with the arterial bleed was screaming, thrashing, spraying blood across the gurney. 2 nurses were trying to hold her down, trying to get pressure on the wound, but she was in shock, wild with pain and terror. Claire moved in, voice low and calm. Hey, look at me. Look at me. You're going to be okay, but I need you to stay still. Can you do that? The woman's eyes locked on hers. Something in Claire's voice cut through the panic. The woman went still. Claire applied pressure, hand steady, bleeding, slowing to a controllable flow. Good. You're doing great. Stay with me. By the time the last patient was stable, the ER looked like a war zone. Blood on the floors, smeared across walls, discarded gloves, empty medication vials, torn packaging everywhere. Exhausted staff leaning against counters, trying to remember how to breathe. Some of them were shaking. A couple of the residents looked like they might throw up. Claire was at the sink, scrubbing her hands. Her scrubs were soaked through, dark with blood that wasn't hers. Her hair had come loose from its knot, strands stuck to her face with sweat. Her expression was blank, like she'd just finished filing paperwork instead of saving half a dozen lives. Cole found her there. He was still in his trauma gown, splattered with blood, his hands shaking slightly from the adrenaline crash. He watched her scrub her hands, methodical, thorough, like she was following a protocol burned into muscle memory. Where did you train? He asked. His voice came out rougher than he intended. She glanced at him, water running over her hands, soap turning pink. Different places. That's not an answer. It's the one I've got. Cole's jaw tightened. He wasn't used to being brushed off, especially not by nurses. You just performed a surgical airway without clearance. You were about to lose her. That's not the point. Claire turned off the water, dried her hands with a paper towel, slow and deliberate. She met his eyes, and for the first time he saw something there that made him uncomfortable. Not defiance, not anger, just a calm, steady assessment, like she was measuring him and finding him lacking. Then what is? She asked. He didn't have a response. She walked past him, back into the ER, and started cleaning up, picking up discarded supplies, wiping down gurneys, resetting the trauma bays for the next wave. Cole stood there, watching her, feeling something shift in his chest that he couldn't name. The next morning, Claire was called into the administrative office. Not her supervisor, not the charge nurse. Administration. The kind of meeting that comes with closed doors and HR witnesses. Cole wasn't there, but he heard about it fast enough. The hospital ran on gossip, and news like this spread faster than a code blue. Apparently, someone had filed a complaint, acting beyond scope, unauthorized procedures, potential liability. The complaint was detailed, timestamps, witness statements, a full breakdown of every intervention Claire had made during the multi-car pileup. Someone had been watching her closely, someone who didn't like what they saw. Claire sat through the meeting without saying much. She answered questions in single sentences, her face unreadable. Yes, she'd performed the cricothyroidotomy. No, she hadn't asked for permission. Yes, she understood the hospital's protocols. No, she didn't regret her actions. The patient had lived. That was what mattered. The administrator, a man named Gerald Hess, mid-50s, with the soft hands of someone who'd never worked a bedside shift in his life, leaned back in his chair and folded his arms. Ms. Whitaker, I'm sure you understand our position. This hospital has policies for a reason. Chain of command exists to protect patients and staff. When you act outside your scope, you put everyone at risk. Claire didn't respond. Do you have anything to say? Hess asked. No. Hess's mouth tightened. Then effective immediately, you're being removed from critical cases pending review. You'll be reassigned to intake and discharge. If you have a problem with that, you're welcome to file a grievance. Claire nodded once, stood, left. Word spread fast. Some of the nurses were pissed. She'd saved lives, and this was the thanks she got? Others shrugged. Rules were rules. She'd overstepped. Didn't matter how good she was. A few whispered that she'd probably lied on her application, that she wasn't even qualified to be in the ER in the first place. Cole didn't say anything publicly, but privately, it bothered him. Not because he liked her, he didn't know her well enough to like her, but because the decision felt wrong in a way he couldn't name. She'd made the right calls, every single one, and now she was being punished for it. Still, he didn't push back. He had his own reputation to protect, his own career to think about. Getting involved in administrative drama was a good way to make enemies, and Silverline wasn't the kind of place that forgave enemies. Claire went back to taking vitals, checking patients in, filling out discharge paperwork. She didn't argue, didn't complain, didn't even look upset. She just did what she was told, head down, mouth shut. For 2 weeks, she was a ghost again, restocking, charting, staying out of the way. But patients still asked for her by name, which annoyed some of the other nurses. A woman with chronic pain asked specifically for the quiet one with the kind voice. A man recovering from a minor stroke refused to let anyone else check his vitals. "Where's Claire?" he kept asking. "I want Claire." It grated on the staff. She wasn't even working critical cases anymore, and somehow she was still the one people remembered. Then the convoy arrived. It was close to midnight on a Thursday. The ER was in its usual grind. A drunk with a head laceration, 2 overdoses, a kid with a broken arm from skateboarding, an elderly woman with pneumonia. Nothing that required the full trauma team. Cole was halfway through stitching up a guy who'd gotten glassed in a bar fight when the lights in the ER flickered once, then steadied. "What the hell?" a resident muttered, looking up at the ceiling. Before anyone could answer, the security radios crackled. Static, then a voice. Clipped and professional. "All staff clear the main entrance. Secure transport incoming. Repeat, secure transport incoming. This is not a drill." The ER went quiet. Nurses looked at each other. Security didn't lock down the ER unless it was something serious. VIP patients, federal witnesses, occasionally a high-profile criminal under guard. But those cases came with advance notice. This didn't. The public entrance doors locked with a heavy clunk. Armed guards appeared, moving into position with the kind of efficiency that made it clear they'd done this before. Not hospital security, not police. These were different. Tactical vests, sidearms, radios with encrypted channels. A resident started to ask a question. One of the guards cut him off. "Stay back, do your job, don't ask questions." Then the secure bay doors opened. Not the public entrance, the private access used for high-level transports. 3 black SUVs rolled in, windows tinted, no plates visible. Behind them, Two military vehicles, Humvees, desert tan, with mounted equipment covered in canvas. The ER went dead silent. Two gurneys were unloaded, surrounded by personnel in tactical gear. Both patients were unconscious, both in combat fatigues, both with field dressings soaked through with blood. No IDs visible, no paperwork, just bleeding and broken, with an armed escort that moved like a human wall. A man in an officer's uniform stepped forward, scanning the room with eyes that missed nothing. He was tall, mid-40s, with the kind of presence that made people stand straighter without realizing it. His voice was clipped, no room for questions. "We need your best trauma team, now." Cole moved forward, still in his gloves from the bar fight sutures. "I'm Dr. Ethan Cole, attending physician. What are we dealing with?" The officer looked him over, assessing. "Classified injuries. High-priority patients. Your team follows our medical officer's lead." Cole bristled. He'd spent 6 years building his reputation at Silverline, and this guy was walking in like he owned the place. "This is my ER, my patients. I need to know what we're treating." The officer's expression didn't change. "Not tonight, doctor." Before Cole could respond, a woman in a military medic's uniform stepped up. She was younger than Cole, maybe early 30s, with short dark hair and eyes that moved like she was reading a tactical map. She didn't wait for introductions. First patient, multiple GSWs, chest and abdomen, probable pneumothorax, possible liver laceration. Second patient, blast injuries, shrapnel wounds, suspected internal bleeding. I need imaging, blood work, and a surgical suite on standby. Move. Her voice wasn't loud, but it cut through the room like a command. The staff hesitated, looking at Cole. Cole's jaw tightened. "We'll assess and—" "Doctor," the officer said, and there was steel in his voice now. "Your team can assist, or you can step aside. Your choice. But these patients are getting treated either way." Cole stared at him, then nodded, once, sharp. "Fine. You heard her. Let's move." The ER exploded into motion. Gurneys wheeled toward trauma bays, monitors hooked up. IV lines started. The military medic was already working, hands moving fast, calling out orders in a language the staff barely understood. Medical terminology mixed with tactical shorthand, a rhythm that came from field work, not hospital training. Claire was standing near the wall, out of the way, watching. She'd been restocking an intake station when the convoy arrived, and now she was just observing, hands loose at her sides, face unreadable. One of the guards noticed her, pointed. "You. We need another set of hands." Claire started to move. An administrator, Gerald Hess, the same one who'd pulled her off critical cases, stepped in, nervous, trying to assert control. "She's not cleared for critical cases." "Hospital policy." The guard looked at Hess like he was a stain on the floor. "I don't care about your internal politics. If she can work, she works." Hess opened his mouth. The officer cut him off. "She works, or you leave. Choose fast." Hess went pale, stepped back. Claire met his eyes for a brief second, then walked to the nearest gurney and started cutting away tactical gear. No hesitation, no questions, just hands that knew exactly what to do. The first patient was in bad shape. Gunshot wounds to the chest and abdomen, entry wounds small, but exit wounds catastrophic. Blood pooling in his chest cavity, lung collapsed, pressure building. The military medic was working fast, but the injuries were stacking faster than she could manage. She called for a chest tube. A resident fumbled with the kit. Too slow. Claire was already there. Kit open. Tube prepped. "Where do you want it?" The medic glanced at her, surprised, then nodded. "Fifth intercostal space. Go." Claire made the incision, inserted the tube, connected the drainage. Blood and air hissed out. The patient's pressure started to stabilize. The medic stared at her. "You've done this before." "Yeah." "Where?" Claire didn't answer, just moved to the next wound, hands already assessing, already calculating. The second patient crashed. Flatline. The monitor's alarm screamed, cutting through every other sound in the ER. "Compressions!" the medic shouted. Claire was already on it. She moved to the head of the gurney, positioned her hands on the patient's sternum, and started compressions. Deep, fast, rhythmic, perfect form. 30 compressions, 2 breaths. 30 compressions, 2 breaths. No hesitation, no fatigue. The medic prepped the defibrillator. Charging? Clear. Claire stepped back. The shock hit. The patient's body jerked. The monitor stayed flat. Again, the medic said, voice tight. Claire resumed compressions. Her arms moved like machines, no break in rhythm, no sign of strain. The medic charged again, shocked again. Nothing. The medic's face tightened. She was losing him. The room felt it. Residents frozen, nurses watching, the armed guards still and silent. Then Claire's voice cut in, calm as glass. Tension pneumothorax, right side. The medic's eyes snapped to her. How do you? Tracheas deviated, neck veins distended, breath sounds absent on percussion. You've got 30 seconds before his heart stops for good. The medic looked. Claire was right. She grabbed a needle, 14 gauge, positioned it, and decompressed the chest. Air hissed out under pressure, loud in the sudden quiet. The monitor beeped, once, twice. A rhythm started, weak, but there. The patient was back. The medic stared at Claire, breathing hard, sweat on her forehead. Who the hell are you? Before Claire could answer, one of the officers stepped closer. He'd been standing near the door watching, but now he moved into the light. His eyes locked on Claire's face, and his expression shifted. Confusion, then recognition, then something close to shock. Whitaker? The room froze. Everyone turned. The medic, the staff, Cole, all of them staring at the officer, then at Claire. Claire looked up, still gloved, still composed, face giving nothing away. She met the officer's eyes and held them. Captain Morales. His voice dropped, disbelief threading through it. What are you doing here? Working. Working? He glanced around the ER, at the staff watching them, at the administrators hovering near the back. Do they know? No. Morales exhaled, slow and deliberate, like he was trying to process something that didn't make sense. He looked at Hess, who was standing near the wall, pale and sweating. You need to pull her file, right now. Hess blinked. I don't think that wasn't a request. Morales' voice went flat, the kind of tone that ended arguments before they started. Pull her personnel file, her training records, everything you have, and you do it now, or I make a phone call that ends your career before sunrise. Hess went white. He turned and half ran toward the administrative offices. The ER was silent. Everyone staring. Claire just stood there, hands at her sides, expression unreadable. Cole found his voice. Someone want to tell me what's going on? Morales looked at him, then at Claire. You've got a former Special Operations combat medic working your ER, and from the looks of it, you've been wasting her. Cole's world tilted. 20 minutes later, Claire's personnel file was spread across the administrative desk. Sealed military records, classified mission summaries, pages and pages of documentation that required clearance levels most of the hospital staff would never have. Combat medic, Tier 1, 3 tours overseas, 16 field hospitals. Operations in zones so hostile they didn't have names, just grid coordinates. Survival rate that made the reviewing officer go silent and read the number twice to make sure he wasn't misreading it. Commendations that didn't have details, just redacted lines and approval signatures from people whose names didn't appear in public databases. Training certifications that included things hospital staff had only seen in textbooks, field amputations, combat surgical procedures, mass casualty triage under fire. The hospital director stood there, pale, hands shaking slightly as he turned the pages. Gerald Hess looked like he was about to be sick. His complaint, the one that had pulled Claire off critical cases, was sitting right there in the file, next to a service record that made it look like a joke. Dr. Cole read the summary twice. Then he looked up at Claire, who was standing in the hallway outside the office, still in her blood-stained scrubs, still quiet. She hadn't changed, hadn't cleaned up, just stood there waiting. You were Special Operations, Cole said, and his voice sounded hollow even to himself. I was a medic. You saved lives in active war zones. I did my job. And you didn't think to mention this? Claire's expression didn't change. She looked at him with those same calm, unreadable eyes. Would it have mattered? The silence that followed was crushing. Because they both knew the answer. It wouldn't have. She'd walked in as a nurse, and that's all anyone had seen. That's all anyone had wanted to see. Captain Morales stepped forward. He was still in his uniform, still carrying the weight of command, and when he spoke, it was with the kind of authority that left no room for argument. Clare Whitaker is cleared for anything in this hospital. Anything. Trauma, surgery, codes, critical care, whatever you've got, she's qualified. If you have a problem with that, you can take it up with the Department of Defense. And trust me, you don't want to do that. No one argued. The administrator who'd filed the complaint, Gerald Hess, was escorted out that night. Pending investigation, they said, but everyone knew what it meant. He'd tried to bury someone who'd saved more lives in a month than he'd overseen in his entire career, and now it was coming back on him. His office was cleared by morning, his access revoked. Lawyers were already involved. The hospital director called an emergency meeting with department heads. Liability assessments, damage control, policy reviews. The phrase wrongful termination lawsuit got thrown around more than once, even though Clare hadn't been fired, just reassigned. But reassigning someone with her qualifications to discharge paperwork? That was its own kind of liability. And Clare? She went back to the ER, restocked the crash cart, checked on the 2 patients from the convoy, both stable now, both sedated, both under armed guard. She didn't say a word about what had just happened, didn't gloat, didn't demand apologies, just went back to work. But the whole hospital knew now. The quiet nurse with the tired eyes and the secondhand scrubs wasn't just quiet. She was a weapon who'd chosen to heal instead of fight. Someone who'd walked through hell and come out the other side with skills that most doctors would never have, experience that couldn't be taught in any classroom. And the people who'd tried to silence her, the ones who'd dismissed her, underestimated her, pushed her aside, they were about to learn what happened when you mistook silence for weakness. Because Clare Whitaker had survived things that would break most people. And if you thought you could bury her with paperwork and hospital politics, you were about to find out just how wrong you were. The night shift continued. The ER kept moving, but something had shifted. The staff looked at Clare differently now. Not with pity, not with dismissal, with something closer to fear, or maybe respect. It was hard to tell the difference. Cole stood in the hallway, watching her work, and for the first time in his career, he felt small. He'd spent years building his reputation, his authority, his control. And in one night, a nurse he'd barely noticed had shattered every assumption he'd ever made. He didn't know what to do with that, but he knew one thing: Clare Whitaker wasn't invisible anymore, and the hospital would never be the same. The silence didn't last. By morning, the entire hospital was talking. Not whispering in break rooms or trading rumors by the coffee machine. This was different. This was the kind of gossip that moved through departments like wildfire, carried by residents who'd witnessed the convoy, nurses who'd seen Clare work, administrators who'd been in the room when her file got pulled. By the time the day shift arrived, everyone knew. The quiet nurse wasn't just a nurse. She was something else entirely. Clare didn't acknowledge it. She finished her shift at 7, clocked out, and walked through the parking lot like it was any other morning. No one stopped her. No one tried to talk to her. They just watched, from windows, from doorways, from behind the glass of the administrative offices, watching her walk to a beat-up Honda Civic with a dent in the passenger door and drive away like nothing had changed. But everything had changed. Dr. Ethan Cole didn't sleep. He went home, showered, sat on his couch with a beer he didn't drink, and stared at the wall. His mind kept circling back to the same moment, Clare stepping in during that first pileup, making the cricothyroidotomy without hesitation, without permission, without fear. He'd been angry then, felt undermined. Now he just felt stupid. She hadn't been showing off. She'd been doing what she was trained to do, and he'd dismissed her because she didn't fit his idea of what competence looked like. He went back to the hospital at noon, even though his shift didn't start until 4. He needed to see her, needed to say something, though he wasn't sure what. An apology felt insufficient. Acknowledgement felt patronizing. He settled on just talking to her, treating her like a colleague instead of a subordinate. But when he got to the ER, she wasn't there. "She called in," Diane said when he asked. The charge nurse was restocking an intake station, her face carefully neutral. Said she needed a personal day. She never takes personal days. Yeah, well, maybe she's tired of being here. Cole heard the edge in her voice. Diane had been one of the nurses who'd defended Claire after the complaint, who'd argued that pulling her off critical cases was a waste. Now she was looking at Cole like he was part of the problem. Maybe he was. He left without saying anything else. The hospital moved through the day with a strange tension humming beneath the surface. Patients came in, got treated, went home. Codes were called. Procedures were done, but the staff kept glancing toward the doors like they were waiting for something. Or someone. Gerald Hess's office was already empty. His nameplate had been removed from the door. His desk was cleared, his files boxed up and taken somewhere none of the regular staff had access to. The official story was that he was on administrative leave pending an internal review. The unofficial story, the one that spread faster, was that he'd been escorted out by hospital security and told not to come back. Someone said they'd seen him crying in the parking lot. Someone else said his wife had been called. No one knew for sure, but everyone had an opinion. By the end of the week, 3 more administrators were placed on leave. The hospital brought in an external review team, lawyers, HR specialists, people in suits who sat in conference rooms and asked uncomfortable questions. They wanted to know who'd filed the complaint against Claire, who'd approved her removal from critical cases, who'd made the decision, and why no one had bothered to check her credentials before sidelining her. The answers, when they came, were ugly. Hess had filed the complaint, but he hadn't acted alone. 2 other administrators had signed off on it. A senior physician, Dr. Raymond Kellerman, who ran the hospital's quality assurance program, had provided a written statement supporting the removal. The reasons were thin, built on protocol violations and liability concerns, but underneath it all was something simpler and meaner. They didn't like that a nurse had made decisions without asking permission, didn't like that she'd stepped outside the hierarchy, didn't like that she'd made doctors look slow. Kellerman was older, mid-60s, with a reputation for being meticulous and unforgiving. He'd been at Silverline longer than anyone, long enough to remember when the hospital was smaller, less corporate, less concerned with rankings and public image. He didn't apologize when the review team questioned him, didn't back down. "I stand by my assessment," he said, sitting across from the lead investigator in a conference room that smelled like stale coffee. She acted outside her scope. That's a fact. Whether she had the skills to do so is irrelevant. We have protocols for a reason. Even if those protocols cost lives? Kellerman's jaw tightened. That's a hypothetical. No, doctor. That's what almost happened. Twice. The investigation expanded. The review team pulled records, interviewed staff, requested copies of every critical case Claire had been involved in since she'd started. What they found made the hospital's legal team nervous. In 3 months, Claire had been present for 42 critical cases. In 39 of those cases, she'd made interventions that weren't technically within her scope, but every single one of those interventions had been correct. Patients who should have died didn't. Complications that should have occurred never did. Her success rate was statistically impossible for someone working at her level. Except she wasn't working at her level. She'd been working below it. The hospital's insurance provider got involved, then the state medical board. Then quietly, a few phone calls were made to people whose names didn't appear on any org chart. By the end of the second week, Claire's personnel file was sealed under federal classification. No one could access it without clearance. No one could talk about it without risking legal action. But the damage was done. Dr. Kellerman was asked to retire. He refused. So they fired him. 2 administrators were let go. Another was demoted. The internal review became public knowledge when a nurse leaked part of it to a local reporter, and suddenly Silverline General was in the news for all the wrong reasons. Hospital silences decorated combat medic. Veteran nurse punished for saving lives. The headlines were brutal. The hospital's PR team went into damage control mode, issuing statements about procedural reviews and commitments to staff development. It didn't help. The story had legs. Through all of it, Claire stayed away. She didn't come back to the hospital for 2 weeks, didn't answer calls from HR, didn't respond to emails from the director's office. Just vanished. Cole tried to find her. He pulled her address from the employee database, an apartment complex on the south side of the city, older building, the kind of place where rent was cheap and no one asked questions. He drove there on a Saturday morning, parked outside, and sat in his car for 20 minutes trying to figure out what to say. He finally got out, walked to her unit, and knocked. No answer. He knocked again. Still nothing. A neighbor opened their door, older woman, gray hair, suspicious eyes. She's not here. Do you know when she'll be back? Nope. Haven't seen her in days. You a cop? No, I'm a doctor. I work with her. The woman snorted. Yeah, well, maybe you should have thought about that before you screwed her over. The door closed. Cole stood there staring at Claire's door, feeling the weight of his own stupidity settle over him like a blanket. He'd dismissed her because she didn't fit his assumptions, treated her like she was disposable because that's what the system told him nurses were. And now she was gone, and he didn't know if she was ever coming back. He left, drove home, tried to move on. But the ER wasn't the same without her. The staff felt it immediately. Codes took longer. Decisions were slower. The rhythm that had started to build during those critical nights, the unspoken coordination, the way people moved when Claire was in the room, was gone. Patients who would have stabilized faster didn't. Complications that shouldn't have happened did. Nothing catastrophic. Nothing that made the news, just small failures, tiny cracks in the system that added up. Diane noticed. We need her back, she said one night, leaning against the nurse's station after a particularly rough shift. This place is falling apart without her. Cole didn't argue. 3 weeks after the convoy, Claire walked back into Silverline General. It was early morning, just after shift change. The ER was quiet. The overnight chaos settled into the lull that came before the day shift ramped up. Claire walked through the doors in clean scrubs, hair pulled back, badge clipped to her pocket. She looked exactly the same. Tired eyes, calm expression, unreadable. Diane saw her first. Jesus, Claire, where the hell have you been? Away. We've been calling. I know. And? Claire didn't answer. She just walked to the supply room and started checking inventory like she'd never left. Word spread fast. Within 10 minutes, half the ER knew she was back. Within 20, the hospital director was on the phone with department heads. Within an hour, Cole was standing in front of her, trying to figure out what to say. She looked up from the supply cart. Dr. Cole. Claire. He hesitated. This was harder than he'd expected. Can we talk? We're talking now. Somewhere private. She studied him for a moment, then nodded. They walked to an empty conference room, the kind used for family meetings and bad news. Cole closed the door. The silence stretched. I'm sorry, he said finally. The words felt inadequate, but they were all he had. Claire didn't respond. I should have backed you up, Cole continued, when they pulled you off critical cases. I should have said something. I didn't. That was wrong. Okay. Okay? He'd expected anger, bitterness, something. Her calm was worse. You did what you thought was right, Claire said. So did I. We're not always going to agree. But I was wrong. Yeah, you were. The bluntness of it stung, but Cole couldn't argue. Are you coming back? I'm here, aren't I? I mean permanently. Claire leaned against the wall, arms crossed. Depends. On what? On whether this place is going to waste my time again. Cole opened his mouth, then closed it. He didn't have an answer for that. The hospital had already wasted her time, wasted her skills, wasted 3 months of her life on intake paperwork and discharge summaries because they couldn't see past their own hierarchy. I can't promise it won't happen again, he said honestly. The system here is broken. You've seen it. But I can promise I won't be part of the problem anymore. Claire looked at him, really looked at him, and for the first time since she'd walked back in, something shifted in her expression. Not forgiveness, not trust, just acknowledgement. That's a start, she said. They went back to work, but the hospital wasn't done with Claire yet. 2 days after she returned, the hospital director called her into his office. His name was Martin Graves, late 50s, with silver hair and a politician's smile. He'd been director for 8 years, long enough to know how to navigate controversy without getting his hands dirty. He gestured for Claire to sit. She stayed standing. Ms. Whitaker, he began, I want to personally apologize for the way you were treated. The actions taken against you were unacceptable, and we've made significant changes to ensure nothing like that happens again. Claire said nothing. Graves continued, undeterred. We'd like to offer you a new position, lead trauma nurse, increased pay, benefits, oversight responsibilities. You'd be working directly with our senior physicians, helping to develop protocols and training programs. No. Graves blinked. I'm sorry? I said no. May I ask why? Claire's expression didn't change. Because you're offering me a title to cover your ass. You don't care about what I can do. You care about how it looks if I leave. Graves's smile faltered. That's not. It is. And we both know it. The silence that followed was cold. Graves leaned back in his chair, reassessing. What do you want then? To do my job. Without interference. That's it. I can arrange that. Can you? Claire's voice was quiet, but there was steel in it. Because the last time I did my job, your administration tried to bury me. So forgive me if I don't trust your arrangements. Graves's jaw tightened. He wasn't used to being talked to like this, especially not by staff. But he also wasn't stupid. Clare had become a PR problem, and the easiest way to solve PR problems was to make them go away, preferably by keeping them happy. Fine. No title, no changes. You work critical cases same as before. But if anything happens, anything, you come to me first. Understood? Claire considered, then nodded. Understood. She left. Graves sat alone in his office, staring at the closed door, wondering if he'd just made a mistake. The ER settled into a new rhythm after that. Claire was back on critical cases, but the dynamic had shifted. Doctors who'd ignored her before now watched her, asking for her input, deferring to her judgment when things got complicated. Residents started shadowing her during codes, trying to learn the techniques she used, the way she read patients, the instincts that seemed to come from nowhere. Cole worked with her more closely now. At first it was awkward, the weight of what had happened sitting between them like a third presence. But slowly, over shifts that blurred into each other, they found a rhythm. He'd make a call. She'd execute it, or she'd suggest an alternative, and he'd listen. They stopped talking about rank, stopped worrying about who was in charge, just focused on keeping people alive. One night, during a code on a woman in her 40s with a massive PE, Claire stepped in with a suggestion Cole hadn't considered. Try a catheter-directed thrombolysis. She's not responding to systemic. Cole looked at her. That's a long shot. So is watching her die. He made the call. It worked. The woman stabilized. Afterward, standing outside the trauma bay, Cole turned to Claire. How did you know? I didn't. I guessed. That wasn't a guess. Claire shrugged. Call it experience. But it wasn't just experience. Cole was starting to realize that. It was something deeper, an instinct built from years of working in places where one wrong decision meant someone didn't go home, where hesitation killed, where you learned to read the invisible signs, the patterns no textbook could teach. The hospital started to change around her. Small shifts at first. Nurses spoke up more during codes. Residents asked questions instead of just following orders. The hierarchy loosened, just a fraction, just enough to let air in. It wasn't a revolution, but it was something. Then the second convoy arrived. It was 3 a.m. on a Tuesday. The ER was quiet, too quiet, the kind of quiet that made experienced staff nervous. Claire was restocking a crash cart when the radios crackled. Same voice as before, same clipped tone. Secure transport incoming. Clear the main entrance. This is not a drill. The ER locked down. Staff moved to the sides. The doors opened, and this time there were 4 vehicles. More guards, more personnel, more patients. But something was different. Captain Morales wasn't there. Instead, a woman in a colonel's uniform stepped out, flanked by 2 armed escorts. She scanned the ER, eyes sharp, looking for someone. Her gaze landed on Claire. Whitaker. Claire straightened. Colonel? The woman walked over, boots echoing on the tile. We've got a situation. 4 critical. 2 are stable enough for your team. The other 2 need immediate surgical intervention, and we don't have time to transport them to a military facility. Cole stepped forward. What kind of injuries? The colonel didn't look at him. She kept her eyes on Claire. Blast trauma. Severe. One's got abdominal shrapnel with suspected vascular damage. The other's got a partially severed femoral artery, and we've been holding pressure for 20 minutes. They need an OR. Now. Claire didn't hesitate. Trauma Bay 2 and 3, get surgical on the line. We'll need vascular and general. Move them. The colonel nodded. The gurneys came in fast, and that's when everything went wrong. The first patient was a man, mid-30s, unconscious, with a tourniquet on his left leg so tight it had cut off circulation completely. The field dressing was soaked through, blood seeping around the edges. Claire moved to assess him, and the moment she loosened the tourniquet to check the wound, blood sprayed across the bay. Arterial, high pressure. The man's pressure dropped instantly. "Clamp," Claire said, her voice steady even as blood covered her gloves, her scrubs, the floor. A nurse handed her a clamp. Claire got it on the artery, but the bleeding didn't stop. The vessel was too damaged, the tear too large. She needed vascular surgery, and she needed it 10 minutes ago. "Where's the surgeon?" Cole shouted. "En route," someone called back. 5 minutes. "We don't have 5 minutes." Claire's mind raced. The man's pressure was dropping, 60 over 40, then 50 over 30. His heart was struggling, trying to pump blood that wasn't there. She had seconds to make a call. "Get me a Fogarty catheter and a suture kit," she said. Cole stared at her. "You're going to repair it here?" "Unless you've got a better idea." He didn't. The equipment came. Claire worked fast, her hands moving with a precision that didn't match the chaos around her. She isolated the artery, cleared the damaged section, and started suturing. It wasn't pretty. It wasn't textbook. But it held. The bleeding stopped. The man's pressure started climbing, 60 over 40, 70 over 50, stabilizing. Cole exhaled, not realizing he'd been holding his breath. But the second patient was worse. This one was a woman, younger, maybe late 20s. The abdominal wound was catastrophic, shrapnel embedded deep, internal bleeding that no amount of field dressings could control. She was conscious, barely, her eyes wide with pain and fear. Claire moved to her side. "Hey, stay with me. What's your name?" "Daniels," the woman whispered. "Sergeant Daniels." "Okay, Sergeant. We're going to take care of you, but I need you to stay calm. Can you do that?" Daniels nodded, tears streaming down her face. Claire started assessing the wound, and her heart sank. The shrapnel had nicked the aorta. Not severed it, just nicked it. But that was enough. Blood was pooling in the abdominal cavity faster than they could replace it. Without immediate surgery, Daniels had minutes. Maybe less. "Where the hell is the surgeon?" Claire shouted. "Stuck in traffic," someone called back. "Accident on the interstate. ETA 15 minutes. 15 minutes might as well have been 15 hours. Claire looked at the colonel, who was standing near the door, face pale. "She's not going to make it 15 minutes. The colonel's jaw tightened. "Then you better figure something out." Claire turned back to Daniels, her mind racing through options. She could open the abdomen here, try to clamp the aorta, buy time. But that was a surgical procedure, not a field intervention. If she screwed it up, Daniels died. If she did nothing, Daniels died anyway. The choice wasn't really a choice. "I need an OR," Claire said. "They're prepping one now," Cole said. "But it's going to take, I don't care how long it takes. Get her there. Now." They moved Daniels, rushing her down the hallway toward the surgical wing. Claire ran alongside the gurney, one hand on Daniels' arm, the other holding pressure on the wound. Blood was still coming, soaking through the dressings, pooling on the gurney. They got to the OR. The doors opened, and that's when the lights went out. Not just in the OR. The entire wing. Emergency backup kicked in after 3 seconds, but those 3 seconds felt like an eternity. The equipment beeped, resetting. The monitors went dark, then flickered back to life. Daniels flatlined. "No," Claire whispered. Then louder. "No. Start compressions. Someone bag her. Move." The team moved, but Claire could see it in their faces. They were losing her. The power outage had disrupted everything. The monitors, the IV pumps, the rhythm they'd built, and Daniels's heart, already struggling, had given up. Claire started compressions herself, her hands moving fast, desperate. Come on, don't you dare die on me." But the monitor stayed flat. And somewhere in the hospital, in a basement utility room no one was paying attention to, someone was smiling. Because the power outage wasn't an accident, the compressions weren't working. Claire could feel it in her arms, in the resistance beneath her palms. Daniel's chest wasn't responding the way it should. The ribs flexed, the sternum compressed, but there was no life coming back. The monitor stayed flat, that terrible single tone cutting through every other sound in the OR. "Charge the defib," Claire said, voice tight. A nurse fumbled with the paddles. The backup power had kicked in, but the equipment was sluggish, taking too long to boot up. Precious seconds bleeding away. "Charging," the nurse said finally. "Clear." Everyone stepped back. The shock hit. Daniels' body jerked. The monitor blipped once, then went flat again. "Again," Claire said. They charged. Shocked. Nothing. Cole was beside her now, gloved and ready. "Claire, her pressure's been too low for too long. Even if we get her back—" "We're getting her back," Claire snapped. She repositioned her hands, started compressions again. "Someone find out what the hell happened to the power." A resident ran out. The rest of the team kept working, bagging Daniels, pushing meds, trying to coax life back into a body that was shutting down. Claire's arms were burning, sweat running down her face, but she didn't stop, couldn't stop. The resident came back, breathless. "Main circuit breaker in the basement. Someone flipped it." The room went cold. "What do you mean someone flipped it?" Cole asked. "I mean, someone went down there and manually shut off power to this wing. Security's checking the cameras now." Claire's hands froze mid-compression. She looked at the colonel, who was standing near the door, face pale but expression locked down tight. "This wasn't an accident." "No," the colonel said quietly. "It wasn't." Claire's mind raced. Someone had sabotaged the hospital during a classified military transport. That wasn't random. That wasn't opportunistic. That was targeted. But there was no time to process it. Daniels was dying. Claire forced herself to refocus. "We need to open her up. Here. Now." "Claire, we don't have—" Cole started. "I don't care what we don't have. She's got an aortic bleed and we're out of time. Either we go in or she dies on this table." Cole looked at the monitors, at Daniel's gray face, at the blood still seeping through the dressings. He made the call. "Do it." Claire grabbed a scalpel. No time for proper prep. No time for sterile protocol. She made the incision fast, midline, deep enough to access the abdominal cavity. Blood welled up immediately, dark and thick. She suctioned it, trying to see, trying to find the source. There. A piece of shrapnel, jagged and cruel, embedded in the abdominal aorta. The vessel was torn, bleeding into the cavity with every weak beat of Daniel's failing heart. Claire's hands moved on instinct. She grabbed a vascular clamp, positioned it above the tear, and locked it down. The bleeding slowed. Not stopped. She couldn't stop it completely without a proper repair, but slowed enough to buy time. "Get me sutures, 4-0 proline, and I need a graft if you've got one." A nurse opened supply cabinets, searching. "We don't keep grafts in this OR." "Then get one from vascular. Run." The nurse ran. Claire held pressure on the clamp, her other hand working to clear away damaged tissue, to isolate the vessel enough to repair it. This wasn't a surgery. This was field medicine in a hospital, the kind of desperate intervention she'd done 100 times in places where the alternative was a body bag. Cole was assisting now, suctioning blood, holding retractors, trying to give her room to work. "Claire, even if you repair this, she's lost too much blood. Her organs, one problem at a time." The nurse came back with a graft. Claire took it, hands steady despite the adrenaline screaming through her veins. She trimmed the damaged section of the aorta, aligned the graft, and started suturing. Each stitch had to be perfect. Too loose, and it would leak. Too tight, and it would tear. She worked fast, her fingers moving with a precision that came from muscle memory, from years of doing this under fire. 5 minutes. 10. The graft held. She released the clamp slowly, watching for leaks. A small amount of blood seeped through one suture line. She reinforced it, checked again. It held. Daniel's heart rhythm started to stabilize. Weak, but present. Claire exhaled, her hands shaking now that the immediate crisis was over. "Close her up, get her to ICU, and someone find out who cut the power." The team moved, efficient now that the worst had passed. Claire stepped back, peeling off her gloves, her scrubs soaked with blood. She looked at the colonel, who was still standing near the door, phone pressed to her ear, speaking in low, clipped tones. When the colonel hung up, her face was granite. "We need to talk, privately." They found an empty office down the hall. The colonel closed the door, checked it twice, then turned to Claire. "That wasn't random." "I figured. We've had concerns about security breaches for weeks. Someone's been leaking classified transport schedules. We thought we had it contained." "We were wrong." Claire leaned against the desk, exhaustion starting to creep in now that the adrenaline was fading. "Who are we talking about? Foreign operatives? Domestic?" "We don't know yet. But whoever they are, they're inside this hospital." The words hung in the air, heavy and cold. Claire's jaw tightened. "You're telling me one of my coworkers just tried to kill your people?" "That's exactly what I'm telling you. And you didn't think to warn us?" The colonel's expression didn't change. "We didn't have confirmation until tonight. Now we do." Claire wanted to argue, wanted to be angry, but she was too tired. "What do you need from me?" "We're locking down the hospital. No one in or out until we find who did this. Military police are already en route. But we need someone on the inside who knows this place, knows the staff, someone we can trust." Claire almost laughed. "You want me to help you investigate my own hospital? You're the only person here with the clearance and the experience." "I'm a nurse." "You're a Tier 1 combat medic with a security clearance higher than most of my officers. Don't pretend you're just a nurse." Claire looked at her, really looked at her, and saw something she recognized, the weight of command, of making impossible decisions, of sending people into danger and hoping they came back. She'd carried that weight once, thought she'd left it behind, apparently not. "Fine," Claire said, "but I'm doing this my way. Wouldn't expect anything else." They went back to the ER. The military police had arrived, a dozen personnel in tactical gear, setting up checkpoints, securing exits, questioning staff. The hospital was in controlled chaos. Patients were being diverted to other facilities. Non-essential staff were being sent home. Everyone else was being detained for questioning. Cole found Claire near the nurses' station. "What the hell is going on?" "Someone sabotaged the hospital during a military transport." "They're investigating." "Investigating who?" "Everyone." Cole's face went pale. "You're serious?" "Very." A military officer approached, young, clean-cut, the kind of guy who probably still believed in protocol and chain of command. "Ms. Whitaker, we need you to come with us." Claire nodded, but before she could move, Diane grabbed her arm. "Claire, wait. They've been asking about you. About your file, your background, why you're here." Claire's stomach tightened. "What did you tell them?" "Nothing, but they're not asking friendly questions." The officer cleared his throat. "Ms. Whitaker, now." Claire followed him to a conference room that had been converted into a makeshift interrogation center. Two officers were waiting, one older, with the hard eyes of someone who'd seen too much, the other younger but no less serious. They gestured for her to sit. She stayed standing. "We need to know about your connection to the patients we brought in," the older officer said. "I don't have a connection. I treated them." "You were specifically requested by Colonel Vance, because I know what I'm doing." "And before tonight? Did you know any of the personnel involved in this transport?" Claire's eyes narrowed. "You think I'm involved?" "We're not accusing anyone. We're gathering information." "That's what you say when you're accusing someone but don't have evidence yet." The younger officer leaned forward. "Your file is classified. Your service record is sealed. You show up at this hospital 3 months ago with credentials that don't match your experience level, and the moment military transports start coming through, there's a security breach. You can see why that raises questions." Claire felt anger flare in her chest, hot and sharp. She'd spent years earning her clearance, her reputation, her place. And now these two were sitting here implying she was a traitor because her file didn't fit their expectations. "My file is sealed because the missions I worked are still classified," Claire said, voice low and dangerous. "I came to this hospital because I wanted a normal job, away from the military, away from the war. And if you think I'd sabotage my own people, you don't know a damn thing about me." The older officer's expression didn't change. "Then help us prove that." Claire stared at him, then sat down. "What do you want to know?" They questioned her for an hour, about her background, her contacts, her movements over the past 3 months, who she'd talked to, who she'd worked with, who had access to her schedule. Claire answered every question, her voice steady, her answers precise. She had nothing to hide, but the whole time she could feel the suspicion in the room, the doubt. When they finally let her go, she walked out feeling dirty, like she'd been stripped down and examined and found lacking. Cole was waiting in the hallway. "Are you okay?" "No?" "What did they ask?" "If I'm a traitor..." Cole's face went hard. "That's insane." "Is it?" Claire looked at him, exhausted. "I've got a classified file, a military background, and I showed up here right when this started. From their perspective, I'm the perfect suspect. But you're not. Doesn't matter what I am. Matters what they can prove." They walked back to the ER in silence. The hospital felt different now, tense, watchful, like everyone was waiting for the other shoe to drop. Staff moved through the halls with their heads down, avoiding eye contact, afraid to say the wrong thing to the wrong person. Claire went back to work because she didn't know what else to do. Checked on patients, restocked supplies, tried to keep her hands busy so her mind wouldn't spiral, but she couldn't stop thinking about the power outage, about the fact that someone in this hospital had deliberately tried to kill Daniels and the other patient, someone who knew about the transport, knew about the timing, knew exactly when to strike, someone who was still here. She was at the supply room counting IV kits when she heard footsteps behind her. She turned. Dr. Raymond Kellerman was standing in the doorway, the man they'd fired, the man who'd supported her removal from critical cases, the man who'd walked out of this hospital 2 weeks ago and shouldn't be anywhere near it now. "Dr. Kellerman," Claire said slowly, "you're not supposed to be here." Kellerman smiled, and it was wrong, too wide, too calm. "I know." Claire's hand moved toward the emergency call button on the wall. Kellerman saw it. His hand came up holding something small and black, a remote detonator. "I wouldn't," he said. Claire froze. Kellerman stepped into the room, closing the door behind him. "You ruined everything, you know. This hospital was mine. I built the protocols, I set the standards, and then you walked in and made me look obsolete, made them all look at me like I was the problem." Claire's mind raced. The power outage, the sabotage. It hadn't been about the military patients. It had been about her, about revenge. "You cut the power," Claire said. "I did more than that." Kellerman's smile widened. "I've been planning this for weeks, ever since they forced me out. Do you know how easy it is to access hospital systems when you've worked here for 30 years? How many passwords I still have? How many backdoors I built into the infrastructure?" Claire's stomach dropped. "What did you do?" "The medication dispensary, the refrigeration units, the backup generators, all controlled by the same system, and all of it is about to fail." He held up the detonator. "One press, and this hospital goes dark, permanently. Patients on ventilators, patients in surgery, patients in ICU. All of them gone. You'll kill hundreds of people. I'll make a point." Kellerman's voice was cold now, the smile gone. "That you can't just throw people away. That experience matters. That I matter." Claire's heart was hammering, but her voice stayed steady. "You won't get away with this." "I don't need to get away with it. I just need to watch it burn." His thumb moved toward the button. Claire lunged. She hit him low, driving her shoulder into his midsection, slamming him into the shelving unit behind him. The detonator flew from his hand, skittering across the floor. Kellerman recovered faster than she expected, his fist catching her in the ribs, knocking the air from her lungs. They grappled, crashing into supply carts, medication trays scattering across the floor. Kellerman was older, but he was stronger than he looked, desperation and rage fueling him. Claire blocked a punch, landed one of her own, felt his nose crunch under her knuckles. He stumbled back, blood streaming down his face, and grabbed a scalpel from a fallen tray. Claire didn't hesitate. She kicked his wrist, hard. The scalpel went flying. Then she swept his legs out from under him, dropping him to the floor. She pinned him, one knee on his chest, her hand on his throat. "Where's the detonator?" she demanded. Kellerman laughed, blood bubbling from his lips. "Too late. I set a timer. You've got 5 minutes before everything goes dark." Claire's blood went cold. She looked around, spotted the detonator near the door, scrambled to grab it. The display showed a countdown. 4 minutes, 38 seconds. She hit the emergency call button, and alarms started blaring throughout the hospital. Security burst in seconds later, followed by military police. They dragged Kellerman away, still laughing, still bleeding. Claire held the detonator, staring at the countdown. 4 minutes, 12 seconds. Colonel Vance appeared in the doorway, out of breath. What happened? He rigged the hospital systems to fail. We've got 4 minutes to stop it. Where's the control panel? Basement, main electrical room. They ran. The hospital was chaos now. Staff evacuating patients, security trying to maintain order, military personnel locking down exits. Claire and the colonel sprinted through hallways, down stairwells, into the bowels of the hospital where the air was thick and hot, and the lights flickered like dying stars. The electrical room was behind a locked door. The colonel shot the lock. They burst inside. The control panel was a nightmare. Wires and circuits and systems Claire didn't recognize, all connected to a device that looked homemade but deadly. The timer on the detonator was synced to it. 3 minutes, 21 seconds. Can you disarm it? The colonel asked. Claire stared at the device, her mind racing through every demolition course she'd taken, every IED she'd seen overseas. This was different, more complex, more unstable. I can try, she said. She knelt beside the device, hands steady despite the adrenaline. She traced the wires, looking for the trigger mechanism, the failsafe, the weak point. There, a wire leading from the timer to the main charge. If she cut it, the timer would stop. But if she cut the wrong wire, the whole thing would detonate immediately. 2 minutes, 45 seconds. Claire's fingers found the wire cutters on her belt, standard issue from her old life, something she'd carried out of habit. She positioned the blades, took a breath, and cut. The timer stopped. For a heartbeat, nothing happened. Then the device started beeping, faster, louder. Run, Claire said. They ran. The explosion came 10 seconds later, blowing out the electrical room, sending smoke and debris into the hallway. Claire and the colonel hit the ground, covering their heads as the shockwave rolled over them. When the dust settled, the lights were out. Emergency backup kicked in, dim and red. Claire's ears were ringing, her body aching, but she was alive. The colonel groaned beside her. Did we stop it? Claire looked back at the destroyed electrical room. The main charge hadn't gone off, just the failsafe, the smaller explosive designed to destroy the evidence. The hospital systems were intact. Yeah, Claire said. We stopped it. They limped back upstairs. The hospital was in chaos, but it was controlled chaos. Patients safe, systems running, staff accounting for everyone. Military police were everywhere now, securing the building, rounding up anyone who'd been in contact with Kellerman. Claire found Cole in the ER, coordinating with the remaining staff. He saw her, covered in dust and blood, and his face went pale. Jesus, Claire, what happened? Kellerman tried to blow up the hospital. He what? Long story. Is everyone okay? Yeah, shaken, but okay. Claire nodded, exhaustion hitting her like a wave. She wanted to sit down, wanted to sleep for a week. Wanted to forget this night had ever happened. But then the colonel appeared, phone pressed to her ear, and her expression made Claire's stomach drop. We've got a problem, the colonel said. Kellerman wasn't working alone. Claire's world tilted. What do you mean? We just ran his communications. He's been in contact with someone else. Someone still in the hospital, and they just activated a secondary device we didn't know about. The emergency lights flickered, and somewhere deep in the hospital, something started to beep. The beeping was faint at first, barely audible beneath the hospital's ambient noise. Monitors, ventilators, the hum of equipment that never stopped. But once Claire heard it, she couldn't unhear it. A rhythmic pulse coming from somewhere above them, steady and methodical, like a heartbeat counting down. Where's it coming from? Claire asked, already moving toward the stairwell. The colonel was on her radio, barking orders to her team. 3rd floor, west wing, near the ICU. Claire's blood went cold. The ICU, where Daniels and the other critical patient were recovering, where the sickest, most vulnerable people in the hospital were hooked to machines that kept them breathing, kept their hearts beating, kept them alive. She ran. Cole was right behind her, shouting questions she didn't have time to answer. Military police flooded the stairwells, boots pounding on concrete, radios crackling with overlapping voices. The hospital's PA system crackled to life. A calm, automated voice announcing a code yellow, asking staff to remain calm and follow evacuation protocols. But there was nothing calm about the way people were moving now. Nurses were wheeling patients toward exits. Families were being herded out by security. The organized chaos was fracturing into something uglier. Claire hit the third floor at a sprint. The beeping was louder here, sharper, coming from somewhere down the hall. She followed the sound, past empty patient rooms, past supply closets, past a nurse's station where monitors had been abandoned mid-shift. The ICU doors were open. Inside, alarms were screaming, not the normal kind, the ones that went off when a patient's vitals dropped or an IV ran dry. These were different, louder, more insistent. Claire pushed through. The ICU was a 12-bed unit, half of them occupied. Patients on ventilators, patients with chest tubes, patients so fragile that moving them could kill them. And in the center of the room, mounted on the main oxygen line that fed every bed, was a device that didn't belong. It was small, black, wired into the hospital's gas system with the kind of precision that spoke to planning, to knowledge, to someone who'd been inside this hospital long enough to know where the weak points were. The timer read 1 minute, 43 seconds. "Get everyone out," Claire said, her voice cutting through the noise. "Now." The ICU staff didn't argue. They started disconnecting patients from wall oxygen, switching to portable tanks, wheeling beds toward the exits as fast as they could without jostling the lines and tubes keeping people alive. It was a nightmare of logistics. Too many patients, not enough hands, not enough time. Claire moved to the device, her mind racing through the same calculations she'd done in the basement. This one was different, smaller, more sophisticated. The wiring was cleaner, the trigger mechanism harder to access. Cole appeared beside her. "Can you disarm it?" "I don't know." "That's not an answer I want to hear. It's the only one I've got." 1 minute, 18 seconds. Claire pulled out her wire cutters, traced the connections. The device was hooked into the oxygen line, which meant cutting the wrong wire wouldn't just trigger the explosive. It would ignite the oxygen itself. The entire ICU would go up in a fireball that would take out half the floor. Her hands were shaking. She forced them still. 59 seconds. She identified the power source, a small battery pack wired to the timer. If she disconnected it, the timer would stop. But there was a failsafe, a secondary trigger tied to the oxygen pressure. If the pressure dropped too fast, the device would detonate, which meant she couldn't just cut the line. 42 seconds. "Claire," Cole said, his voice tight, "we need to go." "Not yet. There's no time." "Then stop talking and let me work." She traced the fail-safe wire, looking for a way to bypass it. There. A junction point where the pressure sensor connected to the main circuit. If she cut there, the fail-safe would disconnect without triggering the oxygen line. She positioned the wire cutters. Her hands were steady now, adrenaline burning away the fear. 28 seconds. She cut. The timer stopped. For a heartbeat, the world held its breath. Then the device started clicking, mechanical, deliberate, a sound that made every hair on Claire's body stand up. "Out," she said. "Everyone out." They ran. Claire grabbed the last portable oxygen tank, shoved it at a nurse who was struggling to move a sedated patient, and sprinted for the exit. Behind her, the clicking grew faster, louder, building toward something she didn't want to be near when it happened. She cleared the ICU doors and dove behind a concrete pillar just as the explosion tore through the room. The blast was smaller than the one in the basement, more controlled, but the fireball that followed was massive. Oxygen ignited in a brilliant orange wave, consuming the ICU in seconds. The windows blew out, equipment melted, the walls turned black. And then it was over. Claire lay on the floor, ears ringing, lungs burning from the heat. Cole was beside her, coughing, his face streaked with soot. The rest of the staff were scattered down the hallway, shaken, but alive. The ICU was gone, completely destroyed. If they'd been 30 seconds slower evacuating those patients, they'd all be dead. Claire pushed herself up, legs unsteady. The colonel was already on her radio again, her face grim. "We've got confirmation. 2 more devices, 4th floor and 6th floor, same setup." Claire's chest tightened. "How many did Kellerman plant?" "We don't know, but we're out of time to figure it out." A military explosives tech appeared, young and wired, carrying a detection kit. "If they're wired the same way, I can track the power signatures, but I need to sweep the whole hospital. That'll take hours. We don't have hours, the colonel said. Claire's mind raced. Kellerman had been at Silverline for 30 years. He knew every system, every protocol, every corner of this place. If he wanted to plant devices, he'd put them where they'd do the most damage. High traffic areas, critical care units, places where failure meant mass casualties. The OR suite, Claire said suddenly. The NICU, the cardiac wing, those are the hardest to evacuate. That's where he'd hit. The colonel nodded. Split up, tech teams on each floor. Whitaker, you're with me. They moved fast, the hospital now fully evacuating under military lockdown. Patients were being loaded into ambulances, transferred to nearby facilities, triaged in parking lots under floodlights that turned the night into a surreal theater of emergency. The press had arrived, news vans lining the perimeter, cameras recording everything, reporters shouting questions that no one had time to answer. Claire and the colonel hit the cardiac wing on the 4th floor. The tech team was already there, scanning walls, equipment, oxygen lines. They found the device behind a ventilation grate, tucked into the ductwork where it would spread fire through the entire floor. The tech got to work. Claire watched, her nerves fraying with every second. The timer read 3 minutes, 42 seconds. How long? The colonel asked. 2 minutes if I'm lucky, the tech said, hands moving with practiced speed. 4 if I'm not. They didn't have 4. Just cut it, Claire said. If I cut the wrong wire, then we die. But if you don't cut anything, we die anyway. So cut it. The tech swallowed, nodded, and made the call. He severed the power line. The timer stopped. The device went silent. 1 down. They moved to the 6th floor, the NICU. 23 premature infants, most of them on ventilators, none of them stable enough to move. The nursing staff had already started evacuating, but it was slow, agonizing work. Every baby had to be disconnected, switched to portable equipment, wrapped in warming blankets to keep their fragile bodies from going into shock. The device was inside the incubator room, wired into the heating system. If it went off, the temperature would spike, then drop, killing every infant in the unit. The timer read 1 minute, 58 seconds. The tech didn't even try to disarm it. He just looked at Claire, face pale. This one's got a mercury switch. If I move it, it detonates. Claire stared at the device, her mind racing. Mercury switches were old school, unstable, designed to trigger on movement, which meant they couldn't remove it, couldn't defuse it, could only wait for it to go off. Unless. The heating system, Claire said. It's controlled by the main thermostat, right? A nurse nodded. Yeah, why? If we shut down the system, the device loses its power source. It won't detonate. But shutting down the heat will drop the temperature. These babies can't regulate their own body heat. They'll go into hypothermia. Not if we move them first. 1 minute, 31 seconds. They moved. Every nurse, every tech, every available hand grabbing incubators and portable warmers and oxygen tanks. The babies were so small, some of them barely 2 pounds, their skin translucent, their lungs struggling with every breath. Claire helped carry a twin set, her hands shaking as she tried not to jostle the fragile bodies. They cleared the room with 40 seconds to spare. The tech shut down the heating system. The device went silent, 2 down. But the night wasn't over. The military police had Kellerman in an interrogation room on the ground floor, surrounded by armed guards and federal agents who'd arrived with the kind of speed that meant someone high up the chain had made calls. Claire walked in without asking permission, the colonel right behind her. Kellerman was handcuffed to a chair, his face swollen from where Claire had broken his nose, blood dried on his collar. But he was smiling. That same wrong smile, like he knew something they didn't. How many devices? Claire asked. Kellerman didn't answer. How many? She repeated, her voice low and dangerous. Enough, Kellerman said. You'll find some. You won't find others. And when they go off, everyone will know what happens when you discard people who built this place. Claire stepped closer, her hands curling into fists. You're going to tell me where they are, or I'm going to make you wish you had. You won't, Kellerman said. You're one of the good ones. You follow rules, you save lives. You don't break people. Claire's hand shot out, grabbing his broken nose and twisting. Kellerman screamed, the sound raw and animalistic. The guards moved forward, but the colonel waved them back. Wrong, Claire said quietly. I save people who deserve it. You don't. She twisted harder. Kellerman's scream turned into a sob. Where are the devices? Or suite, Kellerman gasped. Pharmacy, main generator room, and one more. Where? I'm not telling you. Claire let go. Kellerman slumped in his chair, breathing hard, tears streaming down his face. You will, Claire said. She looked at the colonel. Get me his communications. Every call, every text, every email. Whoever he was working with, they'll know where the last device is. The colonel nodded and left. Claire stayed, staring at Kellerman, watching him break down piece by piece. Why? She asked finally. Why do this? Kellerman looked up at her, his eyes red and wet. Because you made me nothing. I spent 30 years building this hospital's reputation, setting standards, training residents, and then you walked in and made all of it irrelevant, made me irrelevant. So you tried to kill hundreds of people. I tried to prove a point. The only thing you proved, Claire said, is that you were always nothing. You just didn't know it yet. She left him there, sobbing in his chair, and went to find the next device. The OR suite was clear. The tech team had already disarmed the device hidden in the anesthesia gas line. The pharmacy was harder. The device was inside a refrigeration unit holding temperature-sensitive medications, wired to detonate if the temperature changed. They had to remove every vial, every dose, every bottle before they could safely shut it down. The main generator room was a nightmare. The device was wired directly into the hospital's backup power system. If it went off, the entire building would go dark, and everyone on life support would die. But they disarmed it. One by one, they found Kellerman's traps and dismantled them, except for the last one. The colonel came back with Kellerman's communications records. Phone logs, text messages, emails. And buried in the metadata was a name that made Claire's blood run cold. Martin Graves, the hospital director. He's been in contact with Kellerman for weeks, the colonel said, showing Claire the logs. Encrypted messages, coded language. But it's there. Graves knew about the devices. He approved the plan. Claire stared at the records, her mind reeling. Graves had been the one to offer her the lead trauma position, the one to issue apologies and promises, the one who'd seemed concerned about the hospital's reputation. He'd been playing both sides. Where is he? Claire asked. His office. We've got him contained. They found Graves sitting behind his desk, still in his suit, still wearing that politician's smile. But there was sweat on his forehead now, fear in his eyes. This is a misunderstanding, he said as they walked in. I was trying to help Raymond. He was unstable. I was monitoring him, trying to prevent— Shut up, Claire said. Graves blinked. Excuse me? You heard me? Shut your mouth before I shut it for you. The colonel stepped forward, holding up a tablet with the communication logs. You've been in contact with Kellerman since the day he was fired. You helped him access hospital systems. You gave him security codes. You enabled everything he did. That's not— We have the records. Encrypted or not, we cracked them. It's over. Graves's face went pale. He looked at Claire, then at the colonel, searching for an angle, a way out. I can explain. I don't want an explanation, Claire said. I want to know where the last device is. I don't know what you're— Claire slammed her hands on the desk, leaning in close. People are dying. Your people. The staff you're supposed to protect. And you helped plant bombs in their workplace. So you're going to tell me where the last device is, or I'm going to let every news camera outside know that the hospital director is a domestic terrorist. Graves's hands were shaking now. It's in the main server room. Basement level. If it goes off, it wipes every patient record, every backup, everything. Why there? Raymond wanted to erase the hospital's history, make it like Silverline never existed. Claire turned and ran. The basement server room was behind 3 locked doors, protected by security protocols that took precious minutes to bypass. By the time they got inside, the timer was down to 38 seconds. The device was sophisticated, military grade, not something Kellerman could have built alone. It was wired into the server rack, designed to send an electromagnetic pulse through the system before the explosive destroyed the hardware. The tech team was already there, working frantically, but this one was different, more complex. More traps. Can you stop it? The colonel asked. I don't know, the lead tech said, sweat pouring down his face. The EMP trigger is separate from the explosive. If I disarm one, the other might still go off. 22 seconds. Claire looked at the servers at the decades of patient data stored there. Medical histories, treatment plans, records that people needed to stay alive to get the care they required. But they were just data, just ones and zeros. The people upstairs were real. Let it blow, Claire said. What? The tech stared at her. The data's insured. It can be rebuilt. But if that EMP goes off and fries the hospital's electrical system, everyone on life support dies. So cut the explosive, let the EMP trigger, and we'll deal with the consequences. The tech looked at the colonel. She nodded. He made the cut. The EMP went off with a sound like thunder, a pulse of energy that rippled through the basement. Every light went out. Every computer died. The servers went dark. But the explosive didn't detonate. They'd stopped it. Claire stood in the darkness, breathing hard, her body shaking with exhaustion and relief. The emergency lights kicked in, dim and red, casting shadows across the ruined server room. It was over. Upstairs, the hospital was in chaos. Federal agents were arresting Graves, hauling him out of his office in handcuffs while cameras caught every second. Kellerman was already in transit to a federal detention facility. The staff was slowly returning, checking on patients, salvaging what they could from the night's devastation. Claire found Cole in the ER, sitting on a gurney, his head in his hands. He looked up when she approached. Is it done? He asked. It's done. He exhaled, long and shaky. How many did we lose? None. We got everyone out. Cole stared at her, disbelief and exhaustion warring on his face. How? We worked fast. That's not an answer. It's the only one that matters. They sat in silence for a moment, the weight of the night settling over them. The ER was a mess. Equipment scattered, blood still on the floors, the lingering smell of smoke and fear. But they'd survived. They're going to want to talk to you, Cole said. The feds, the press, everyone. I know. What are you going to tell them? Claire looked around the ER, at the staff slowly piecing their world back together, at the patients being wheeled back in, at the hospital that had tried to kill her and bury her and dismiss her, and had failed. The truth, she said, that we did our jobs. The press conference happened 3 days later. Federal investigators had finished their preliminary reports. The hospital's board had been dissolved. Criminal charges were filed against Graves, Kellerman, and 2 other administrators who'd been complicit. Claire stood at a podium in front of a room full of cameras and reporters, the colonel beside her, and told the story. Not all of it, some details were still classified, but enough. Enough for people to understand what had happened, what had almost happened. The questions came fast. Miss Whitaker, is it true you're a decorated combat veteran? I served, yes. Why didn't the hospital know about your background? They didn't ask. Do you feel the hospital failed you? Claire paused, choosing her words carefully. The hospital failed a lot of people, but we're going to fix that. How? By doing better. It wasn't a satisfying answer for the press, but it was the truth. In the weeks that followed, Silverline General was rebuilt. New leadership, new protocols, new oversight. The staff who'd stood by Claire were promoted. The ones who'd tried to bury her were gone. Daniels recovered. So did the other military patient. Both of them were transferred to a specialized facility, but before they left, Daniels found Claire in the hallway. I wanted to say thank you, Daniels said, for not giving up. Claire shook her head. I was just doing my job. No, Daniels said quietly. You were doing more than that. You were proving that some people can't be broken. Claire didn't know what to say to that, so she just nodded and Daniels walked away, limping but alive. The hospital slowly returned to normal. Patients came in, got treated, went home. The rhythms of emergency medicine settled back into place. But something had changed. The staff looked at Claire differently now, not with dismissal, not with suspicion, with respect. She was still quiet, still kept to herself, still didn't talk much about her past. But when a code was called, when a patient was crashing, when the impossible walked through the doors, everyone looked to her. and she stepped forward, because that's what she did. 1 month after the attack, Claire was restocking a supply cart when her phone buzzed. A text from an unknown number. She almost deleted it, but something made her open it. The message was simple. "There's one more." Her blood went cold. She looked around the ER, at the staff working, at the patients waiting, at the hospital that had finally started to feel safe again, and realized it wasn't over. Not yet. Claire stared at the message, her thumb hovering over the delete button. Every instinct told her to ignore it, to assume it was a prank, someone trying to rattle her after everything that had happened. But the part of her that had survived 3 tours, that had learned to trust her gut in places where hesitation meant death, wouldn't let her dismiss it. She forwarded the message to Colonel Vance. The response came within minutes. "Don't move. I'm sending a team." Claire pocketed her phone and scanned the ER. Everything looked normal. Patients in beds, nurses charting, residents huddled over a tablet discussing a case. But normal didn't mean safe. Not anymore. She'd learned that lesson the hard way. Learned it in the basement when Kellerman's first device had nearly taken out half the hospital. Learned it again in the ICU when flames had consumed equipment worth millions and nearly consumed lives worth infinitely more. She walked to the security office, moving with the kind of casual purpose that didn't draw attention. The guard on duty was scrolling through camera feeds with the kind of bored attention that came from watching screens where nothing ever happened. His name was Marcus, mid-20s, built like he spent his off hours at the gym, but his on hours eating donuts. "I need to see the footage from the last hour," Claire said. "All cameras, especially the ones covering the supply areas and restricted access points." Marcus looked up, annoyed. "You need authorization for—" Claire leaned on the desk, her voice dropping into the register she'd used overseas when giving orders that weren't up for debate. "Get me the footage, now." Something in her expression, maybe the flatness of her eyes, maybe the way she stood like she was ready to vault the desk and do it herself, made him decide not to argue. He pulled up the feeds, his fingers moving across the keyboard with the hunt and peck method of someone who'd never learned to type properly. Claire watched, her eyes moving across multiple screens, looking for anything out of place. A person lingering too long, a face she didn't recognize. Movement in areas that should be empty. The hospital had thousands of employees, hundreds of visitors every day, contractors coming and going. Finding one person with malicious intent was like finding a single poisoned needle in a field of clean ones. Then she saw it. 3rd-floor hallway, near the medication storage. A figure in scrubs, face partially obscured by a surgical mask, moving with purpose. They stopped at a supply closet, glanced around with the quick, furtive motion of someone checking for witnesses, then slipped inside. "Who's that?" Claire asked, pointing at the screen. Marcus zoomed in, but the angle was wrong. The face was hidden, the body language gender-neutral, the scrubs generic hospital blue. "Can't tell. Could be anyone." "How long ago?" 12 minutes. Claire was already moving, her body making the decision before her mind caught up. She heard Marcus calling after her, something about waiting for security, but she didn't slow down. 12 minutes was an eternity in hospital time. 12 minutes was enough to plant a device, set a timer, and disappear into the crowd of staff and patients that moved through Silverline like blood through veins. She took the stairs because elevators were death traps when you were in a hurry, her legs burning as she climbed 2 steps at a time. Her phone buzzed, Colonel Vance calling, but she ignored it. No time to explain, no time to coordinate, just time to move. The 3rd floor was quieter than usual. Most of the staff focused on the eastern wing where a cardiac patient had just come in with ST elevation and a blood pressure that kept trying to bottom out. Claire moved down the hallway, every sense on high alert, her hands loose at her sides the way they'd been when she'd patrolled forward operating bases where every doorway could hide an enemy. The supply closet door was closed but not locked. Standard hospital policy. Quick access for staff in emergencies. But it also meant quick access for anyone with bad intentions and a decent poker face. Claire pulled it open. Empty, but not untouched. A stack of boxes had been moved, pushed aside to access the wall behind them. Gauze packages, IV starter kits, non-rebreather masks, all shoved to the left with the kind of careless haste that said someone had been working fast. And mounted on the wall, partially hidden behind a ventilation grate that had been unscrewed and left hanging, was a device identical to the ones Kellerman had planted. The timer read 18 minutes, 47 seconds. Claire's heart hammered against her ribs, adrenaline flooding her system with the familiar cocktail of fear and focus that had kept her alive overseas. She pulled out her phone, took a photo, sent it to the colonel. Then she knelt beside the device, studying it with the kind of attention she'd once given to IEDs buried in roads that looked exactly like every other road. This one was different, cleaner, more professional. The wiring was compact, the connection soldered instead of twisted, the trigger mechanism hidden behind a tamper-proof casing that gleamed dully in the fluorescent light. Whoever had built this knew what they were doing. This wasn't Kellerman's work. He'd been good, but this was better, more refined, more deadly. She didn't have the tools to disarm it, didn't have the training for something this sophisticated. The devices she'd dealt with in the field had been crude, built from artillery shells and cell phones, designed by insurgents working with whatever materials they could scavenge. This was different. This was military grade or close to it. But she knew someone who did have the training. She called the military explosives tech who'd worked the previous devices. His name was Lieutenant Marcus Shaw, a kid from Montana with steady hands and eyes that had seen too much for someone barely 30. He answered on the second ring. "Whitaker, what's wrong?" "I found another one, third floor, west wing supply closet, timers at 18 minutes. She heard him swear, heard movement in the background, boots on pavement, car doors slamming. "I'm 30 minutes out, traffic's a nightmare. Can you contain it?" "I don't know, it's more advanced than the others." "Don't touch it, don't move it, just evacuate the floor and wait for me." "That's not an option." "Claire, if I evacuate, whoever planted this will know we found it. They'll trigger it remotely or disappear before we can catch them. I need to keep this quiet." Shaw was silent for a beat, and Claire could almost hear him thinking through the variables, calculating risk versus reward, duty versus pragmatism. "Describe what you're seeing." Claire walked him through the device, every wire, every connection, every component she could identify. The power source looked like a lithium battery pack, commercial grade, probably pulled from a power tool. The explosive was compact, maybe C4 or something similar, enough to take out the floor and everyone on it. The trigger mechanism was the sophisticated part, digital, with redundancies, designed by someone who knew how bomb techs thought. Shaw listened, asked questions, his voice steady despite the clock ticking down in both their heads. Claire could hear traffic in the background, horns honking, Shaw swearing at drivers who couldn't move fast enough. "Okay," he said finally. "There's a pressure plate under the casing. If you try to remove the device, it detonates. But there's a bypass, a magnetic lock on the left side. If you can disengage it, you can access the main circuit without triggering the plate." "How do I disengage a magnetic lock?" "You need a strong magnet, hospital grade, like the kind used in MRI machines." Claire's mind raced. The MRI suite was 2 floors down, through locked doors that required badge access she didn't have, past technicians who'd ask questions she didn't have time to answer. Getting a magnet would take 10 minutes minimum, and she had 17 on the timer and counting down. But there was another option. "Hold on," she said. She ran to the nurse's station, her footsteps echoing in the quiet hallway. The charge nurse looked up, startled, but Claire didn't slow down to explain. She grabbed a medication cart, the heavy kind on wheels, stocked with emergency supplies, and wheeled it back to the supply closet, the wheels squeaking protest at the speed. Mounted on the side of the cart was a magnetic strip used to hold metal instruments. Scissors, hemostats, needle drivers. It wasn't MRI grade, wasn't even close, but it was all she had. She ripped it off, the adhesive giving way with a sound like tearing skin, and returned to the device. Her hands were steady as she positioned the magnetic strip against the lock, holding it flush, applying pressure. Nothing happened. "It's not strong enough," she said into the phone, which she'd wedged between her shoulder and ear. "Then you need to evacuate, now." 14 minutes, 32 seconds. Claire looked at the device, at the timer counting down, at the wires that held the fates of everyone on this floor in their copper veins. She thought about Daniels, about the patients in the ICU, about the people who'd survived the last attack only to be threatened again. She thought about the staff who'd started to trust that Silverline was safe again, that the nightmare was over. She wasn't letting this happen. There has to be another way, she said. Shaw hesitated, and in that pause Claire could hear him wrestling with protocol, with the rules that said civilians didn't defuse bombs, that you waited for the professionals even if waiting meant people died. There is, but it's risky. Tell me. The timer's powered by a lithium battery. If you can short-circuit it, the timer stops. But you have to do it exactly right, or the fail-safe triggers and the whole thing goes off. How do I short-circuit a battery? You need a conductor, something metal. Touch it to the positive and negative terminals at the same time. Claire looked around the supply closet. Shelves of bandages, IV supplies, saline bags, boxes of gloves, rolls of medical tape, bottles of antiseptic. Nothing metal except her wire cutters. The same ones she'd used in the basement, the ones she carried out of habit from her old life, the ones that had already saved lives once. 12 minutes, 8 seconds. Walk me through it, she said. Shaw's voice was tight now, the calm professionalism fraying at the edges. She could hear the fear underneath, the knowledge that he was giving instructions that could kill her if she made one wrong move. The battery's behind the main panel. You'll see 2 contact points, one red, one black. Touch both simultaneously with the conductor. Hold it for 3 seconds, then pull away fast. What happens if I do it wrong? You won't have time to know. Claire positioned the wire cutters, her hands steadier than they had any right to be. She could hear her own heartbeat, loud and insistent, drowning out the ambient noise of the hospital. Could hear her breathing, controlled and even, the way she'd been taught in combat stress training. Could hear Shaw on the phone, holding his breath, waiting. She touched the contacts. The device sparked, a brief flash of light and heat that made her flinch. Electricity arced between the terminals, blue-white and angry. And for a split second she thought she'd failed, thought the failsafe had triggered and she had microseconds left to live. The timer flickered, went dark, then reset to 0, and stopped. Claire exhaled, her whole body shaking, adrenaline crash hitting her like a physical blow. Her hands were trembling now, the wire cutters clattering to the floor. It worked. You're insane, Shaw said, but there was relief in his voice, genuine and raw. I've been told. She heard footsteps in the hallway, fast, deliberate, not the casual pace of hospital staff moving between tasks. She turned just as a figure appeared in the doorway, silhouetted against the fluorescent light. Not military, not hospital security, not anyone she recognized. A woman in her 40s wearing scrubs that didn't quite fit, the pants too short, the top too loose, like she'd grabbed them from a locker room in a hurry. Her face was pale and drawn, lines of stress carved deep around her mouth and eyes. Her hair was pulled back in a ponytail that looked 3 days old. Claire recognized her from the security footage. Step away from the device, the woman said. She was holding a phone in her left hand, her thumb hovering over the screen. Her right hand was in her pocket, gripping something Claire couldn't see. Claire's stomach dropped. A remote trigger. The manual timer had been a decoy, or a backup, or both. This woman could detonate the device with a single tap. "Who are you?" Claire asked, keeping her voice calm, non-threatening, the tone she'd used to talk down soldiers on the edge of breaking, civilians caught in crossfire, anyone whose next decision could mean life or death. "Someone who lost everything because of you." "I don't know you." "You wouldn't. I'm nobody, just a lab tech, bottom of the ladder, invisible." The woman's voice cracked on the last word, bitterness and grief mixing into something toxic. "Raymond Kellerman gave me a chance when no one else would. Saw something in me, believed in me, treated me like I mattered, and you destroyed him." Claire's mind clicked through the implications like tumblers in a lock. This wasn't just about Kellerman's vendetta anymore. He'd recruited someone loyal enough to continue his work even after he'd been arrested, even after the attacks had failed, even knowing what would happen when she was caught. "Kellerman tried to kill innocent people," Claire said carefully, each word chosen like she was diffusing another bomb, this one made of emotions instead of explosives. "He tried to expose a broken system, tried to show everyone what this hospital really is, a machine that chews people up and spits them out, and you stopped him. You protected the same system that dismissed him, that dismissed me, that dismisses everyone who doesn't fit their perfect little hierarchy." "I stopped him from committing mass murder." The woman's hand shook, her thumb moving closer to the screen. "Murder. That's what you call it. I call it justice. I call it making people pay attention, making them see what they've ignored for years. Claire took a slow step forward, hands visible, movements deliberate. You don't want to do this. You don't know what I want? Then tell me. The woman's eyes were wet now, anger and grief warring on her face. Her whole body was shaking, not just her hands. I want to matter. Just once. I want people to remember my name. I want them to know that Angela Reeves existed, that she worked here for 15 years, that she showed up every single day and did her job and never complained and never caused problems. And I want them to know that when she finally asked for something, just a little recognition, a little respect, they ignored her. Claire felt something shift in her chest. Not sympathy exactly, but recognition. She'd been where Angela was standing, in that dark place where invisibility felt like death, where being overlooked day after day wore you down until you forgot what it felt like to be seen. I know what it's like, Claire said quietly. Angela laughed, bitter and broken. You? You're a hero. Decorated combat veteran. The woman who saved the hospital. Everyone knows your name now. They know it because I refuse to be invisible anymore. Not because I planted bombs. Not because I hurt people. Because I did the work and made them see me. That's easy for you to say. You have skills, experience, a military record that makes people respect you. I have those things because I earned them. In places where no one cared about my name, where I was just another medic trying to keep people alive. I know what it's like to be nobody, Angela. I know what it's like to feel like you're screaming and no one can hear you. Then why do you defend them? Angela's voice cracked again, desperation bleeding through the anger. Why do you protect a system that treats people like us like we're disposable? I don't defend the system. I defend the people who deserve better from it. The patients who come here scared and hurting and trusting us to help them. The staff who actually care, who show up every day and do the work even when no one notices. The ones who are trying to fix what's broken instead of burning it all down. No one noticed me. I'm noticing you now. The silence stretched, fragile and tense, like glass under pressure. Angela's thumb was still hovering over the phone screen, one tap away from ending everything. Claire could see the battle playing out on her face, the desire to be heard warring with the reality of what she was about to do, the need to matter wrestling with the knowledge that this wasn't the way. Claire took another step. What's your name? Your full name? Angela blinked, surprised by the question. What? Your name. I want to know it. Angela Marie Reeves. Angela Marie Reeves, Claire repeated, letting the name hang in the air between them, giving it weight, making it real. How long have you worked at Silverline? 15 years. What do you do, specifically? I'm a lab tech. Hematology. I process blood samples, run counts, flag abnormalities. That's important work. It's invisible work. No, it's essential work. Doctors can't diagnose without lab results, can't treat without knowing what's happening in a patient's blood. You're the reason people get the right medications, the right interventions. You save lives every day, Angela. You just do it quietly. Angela's face crumpled, tears spilling down her cheeks. Then why doesn't anyone see it? Why doesn't anyone care? Because the system's broken. Because hospitals are built on hierarchies that put doctors at the top and everyone else at the bottom, and that's wrong. But you know what? You're not fixing it like this. You're just proving them right, proving that people like us are dangerous when we get desperate. I am desperate, Angela whispered. Raymond's gone. My marriage fell apart. My kids won't talk to me. I've got nothing left. Nothing except this, except proving I can make them pay attention. They're paying attention. I'm paying attention. Right now, in this moment, you matter to me. Not because you're holding a detonator, because you're a person who's hurting, and I don't want to see you throw your life away. My life's already gone. It's not. You can still walk away from this. And go where? Do what? I'm going to prison either way. I've already committed half a dozen felonies just planting this thing. Maybe. But there's a difference between prison for conspiracy and prison for mass murder. There's a difference between making a mistake and becoming a monster. And you're not a monster, Angela. You're just someone who got lost and listened to the wrong person. Angela's hand dropped slightly, the phone lowering. Her whole body sagged, exhaustion and despair replacing the frantic energy that had been holding her upright. He told me we could change things, that if we made them see what they'd done, made them face the consequences, they'd have to fix it. He lied to you. Kellerman didn't want to fix anything. He wanted revenge, and he used your pain to get it. I believed him. I know, and I'm sorry. Sorry that you were hurting enough to believe him. Sorry that this hospital failed you the same way it failed him. But this isn't the answer. You know it's not. Angela looked at the phone in her hand, at the screen that would end lives with a single touch. Claire watched her face, watched the internal battle, watched her thumb move away from the trigger, and then Angela's hand dropped completely. The phone slipped from her fingers, clattering to the floor. Claire moved fast, training taking over. She kicked the phone away, sending it skittering across the tile and into the hallway. Then she grabbed Angela's wrist, spinning her around with practiced efficiency, restraining her with zip ties she'd grabbed from the medication cart. Angela didn't fight. She just collapsed, sobbing, all the fight draining out of her like water from a punctured bag. Her knees buckled and Claire had to hold her up, had to support the weight of a broken person who'd made terrible choices and would spend years paying for them. Security arrived seconds later, boots pounding on tile, radios crackling. Then the military team led by Colonel Vance, weapons drawn, faces grim. They took Angela into custody, secured the device even though Claire had already disarmed it, swept the rest of the floor looking for additional threats. Shaw arrived 20 minutes later, out of breath, carrying his equipment kit. He looked at the disarmed device, at Claire, and shook his head. You really are insane. So you keep saying, I'm serious, that was a military-grade trigger mechanism. You shouldn't have been able to disarm it. But I did. Yeah. Shaw smiled, tired and genuine. You did. The interrogation of Angela Reeves took hours, conducted in a secure room in the hospital's basement with federal agents, military investigators, and enough recording equipment to make Hollywood jealous. Claire sat in on part of it, called as a witness, watching Angela break down piece by piece as she gave up everything. How Kellerman had recruited her 6 months before he was fired, spotting her vulnerability the way predators always did. How he'd cultivated her loyalty over coffee in the cafeteria, sympathetic conversations about the way the hospital treated support staff, shared grievances that bonded them together. How he'd convinced her that the only way to be heard was to make noise so loud they couldn't ignore it. She planted the final device 2 days ago, slipping into the supply closet during a shift change when the hallways were chaos, and no one paid attention to one more person in scrubs. The text to Claire had been Angela's idea, a taunt, a way to prove she could still strike even with Kellerman in custody, even with the hospital on lockdown. But she'd underestimated Claire, just like everyone else had. Federal charges were filed that evening: conspiracy to commit terrorism, attempted murder, possession of explosive devices, obstruction of justice. The list went on, each charge carrying years, the total adding up to a life sentence if convicted. Angela would die in prison, her name remembered but not the way she'd wanted, her legacy reduced to a footnote in Silverline's dark history. The press covered it all: the final device, the dramatic disarming, Angela's arrest, Claire's role in stopping it. News vans multiplied outside the hospital like a virus, reporters camping out with cameras and microphones, desperate for interviews, for angles, for the story that would get them ratings. But this time, Claire refused everything. Refused interviews, refused photo ops, refused to be the face of the story. She'd had enough of cameras, of questions, of being held up as a symbol when all she wanted was to do her job and go home and sleep for a week straight. The hospital held a memorial service 2 weeks later for the staff and patients who'd been affected by the attacks. No one had died, a miracle that still felt surreal when Claire thought about it. But trauma didn't require a body count. People had been hurt physically, emotionally, psychologically, in ways that would take years to heal, if they healed at all. Claire attended but stood in the back, away from the speeches and the spotlight, watching families embrace and staff support each other, and a community that had been fractured start to knit itself back together like torn tissue healing around sutures. Dr. Cole found her afterward, navigating through the crowd with the determination of someone on a mission. He looked better than he had in weeks, cleaner, rested, like he'd finally started sleeping again. You should have been up there, he said without preamble. You saved this place. Multiple times. We all did, Claire said. The same response she gave every time someone tried to make her into something she wasn't. That's not what I saw. Then you weren't looking hard enough. Cole smiled, tired but genuine. The kind of smile that came from surviving something terrible and making it out the other side. You know, when you first started here, I thought you were just another nurse. Someone passing through on their way to somewhere better. I am just another nurse. No, you're not. And I'm sorry it took me so long to see that. Sorry it took bombs and fires and near-death experiences to make me realize that the person I'd been dismissing was the most capable person in this hospital. Claire looked at him, at the exhaustion in his eyes, at the weight he was carrying. She recognized it because she'd carried it herself. The burden of being responsible for lives, of making split-second decisions that meant the difference between someone going home or going to the morgue. You're a good doctor, Cole. You just needed to remember that healing isn't about hierarchy. It's about doing what's right, even when it's hard, especially when it's hard. You make it sound easy. It's not, but it's worth it. Cole nodded, started to say something else, then stopped. Just extended his hand instead. Claire shook it, feeling the calluses on his palm from years of suturing and procedures, feeling the strength in his grip that came from pulling people back from the edge. The hospital's new director, Dr. Sarah Lim, brought in from outside with a mandate to rebuild and a reputation for not tolerating institutional dysfunction, called Claire into her office a week later. Lim was younger than Claire expected, mid-40s, with sharp eyes and a direct manner that reminded Claire of her commanding officers overseas. No nonsense, no politics, just mission and execution. I want you to lead our new trauma program, Lim said without preamble, gesturing for Claire to sit. Full authority, your own team, budget for equipment and training, protocols designed around what actually works, not what looks good on paper or protects administrators from liability. Claire sat across from her, considering. A month ago, she would have said no without hesitation, would have walked away from the offer because it came with attention, responsibility, the kind of visibility she'd been avoiding since she'd left the military. But things were different now. She was different now. On one condition, Claire said. Name it. I want to train the entire staff, not just trauma nurses or ER physicians. Everyone. Residents, nurses, techs, lab workers, janitorial staff, security. Everyone who works in this hospital. Because the next time something like this happens, and it will, somewhere, someday, they need to know they can handle it. They need to know they're capable of more than the system tells them they are. Lim smiled, the first genuine smile Claire had seen from her. Done. When can you start? Tomorrow. The training program started 2 weeks later, after Claire had designed the curriculum and recruited instructors and commandeered the hospital's conference center for what would become an intensive, ongoing education program. She stood in front of a room full of hospital staff on the first day, some of them skeptical, some of them eager, all of them watching her with a mix of curiosity and respect that still felt strange. Most of you know me as the nurse who stopped the attacks, Claire began, her voice carrying to the back of the room without needing a microphone. But that's not who I am, not really. I'm someone who learned how to stay calm when everything's falling apart. Someone who figured out that the person next to you, the one you've been ignoring or underestimating or dismissing as just a nurse or just a tech, might be the one who saves your life when things go sideways. She paused, letting the words settle, watching faces in the crowd. Some were nodding, some were skeptical. Some were scared, which was good. Fear meant they understood the stakes. This program isn't about making you heroes, Claire continued. It's about making you ready. Ready to handle the worst day of your life and come out the other side. Ready to trust yourself when no one else does. Ready to step up when everyone else is stepping back. Ready to be the person someone needs when their world is ending. The room was silent, listening. You're going to make mistakes, Claire said. You're going to doubt yourself. You're going to wonder if you're good enough, smart enough, strong enough, brave enough. And the answer is yes. You are. All of those things. But only if you're willing to do the work. Only if you're willing to push past the fear and the doubt and the voice in your head that says you can't. She saw heads nodding now. Saw people sitting up straighter, leaning forward. So here's what we're going to do. We're going to train until these skills are instinct. Until you don't have to think, you just act. Until the person who was invisible yesterday becomes the one everyone looks to tomorrow. Until the system that tried to keep you small realizes it can't anymore. The training was brutal by design. Simulations that pushed staff to their breaking points and then passed them. Scenarios designed to strip away assumptions and force real decisions under pressure. Mass casualty drills. Code simulations with complications stacking on complications. Equipment failures. Communication breakdowns. Everything that could go wrong, compressed into exercises that left people shaking and exhausted and better than they'd been before. Claire didn't coddle anyone, didn't offer false praise or participation trophies. Just honest feedback delivered with the kind of respect that came from treating people like they were capable of more than they believed, like they were soldiers who could be trained instead of civilians who needed protection. You hesitated, she'd tell someone who'd frozen during a simulation. In real life, that patient dies. Again. Or, good call on the airway, but you missed the pneumothorax. Listen to breath sounds, not just what the monitor tells you. Or, you let the doctor overrule you even though you were right. Next time, speak up louder. Lives matter more than egos. And slowly, incrementally, the hospital changed. Nurses started speaking up in codes, offering suggestions, challenging decisions when something didn't feel right. Residents stopped deferring blindly to hierarchy and started thinking critically, questioning protocols that didn't make sense. Lab techs spoke up when results looked wrong instead of just reporting them. Security learned basic triage so they could help instead of just watch during emergencies. The ER became faster, sharper, more cohesive. Response times dropped. Error rates fell. Patient outcomes improved in ways that showed up in the data, in the metrics, in the lives that were saved because someone had been trained to see what others missed. People stopped being invisible. 6 months after the attacks, Claire was restocking a supply cart, still doing the basic work because it grounded her, kept her connected to the reality of nursing instead of just management and training. When a familiar voice called her name, she turned to see Sergeant Daniels walking through the ER doors, limping slightly but smiling, looking healthier than she had any right to after nearly dying on an operating table. "I'm back on active duty," Daniels said, crossing the space between them. "Wanted to thank you in person." Claire shook her hand, feeling the strength in Daniel's grip, seeing the life in her eyes that had been absent when she'd been bleeding out on a gurney. "You did the hard part. I just kept you alive long enough for your body to do the rest. That's not a small thing. It's my job." Daniels grinned, the expression transforming her face from serious soldier to someone younger, lighter. "You know, when I was lying on that table, bleeding out, I heard you. You told me to stay with you, to stay calm, to keep fighting. And I did. Because your voice made me believe I could, made me believe someone gave a damn whether I lived or died." Claire didn't know what to say to that. The words felt too big, too heavy, like trying to carry something that didn't fit in her hands. So she just nodded. "The world needs more people like you," Daniels said seriously. "The world needs more people who don't give up on each other, who see someone struggling and help instead of walking past. That's all I did. The rest was you." Daniels left after a few more minutes of conversation. Back to her unit, back to her life, back to whatever missions waited for her. Claire watched her go and felt something settle in her chest. Not pride exactly, but satisfaction. The knowledge that what she'd done mattered, that Daniels would keep living because of decisions made in seconds, skills built over years. A year after the attacks, the hospital held a ceremony. Not for Claire specifically, though her name was mentioned more than once. For the staff. For everyone who'd survived, who'd rebuilt, who'd refused to let fear win. For the people who showed up every day and did the work even when it was hard. Even when they were scared. Even when they wondered if it was worth it. Claire stood in the crowd, watching Dr. Lim speak, watching staff receive recognition for excellence, watching a system that had been broken start to resemble something better. Not perfect, it would never be perfect, but better, functional, humane. She thought about Angela Reeves, sitting in a federal prison somewhere, paying for choices born from desperation and loneliness and the manipulation of someone who'd used her pain as a weapon. She thought about Kellerman, rotting in a different cell, his name now synonymous with terrorism instead of excellence. She thought about Graves, stripped of his medical license, facing trial for conspiracy and endangerment, his political smile replaced by the blank expression of someone whose world had collapsed. Justice had been served. But it didn't feel triumphant. It felt necessary and sad and inevitable, like amputating a limb to save a life, painful, irreversible, but required. After the ceremony, Cole approached her with 2 cups of coffee, handing her one without asking if she wanted it. She took it, because the gesture was kind, and she'd learned to accept kindness instead of deflecting it. "You gonna stay?" he asked. Claire looked around the hospital, at the people she'd trained, the systems she'd helped rebuild, the place that had tried to bury her and failed spectacularly. "Yeah, I think I am." "Good, because we need you." "You don't need me. You need to keep remembering what you're capable of. What everyone here is capable of when they're given the chance and the training and the respect they deserve." Cole smiled. "Maybe, but it helps having someone around to remind us when we forget, when we start slipping back into old habits." "Then I guess I'll stick around. Someone has to keep you honest." Claire went back to the ER that night for her regular shift, her station, her supplies, her place in the machinery of emergency medicine that never stopped, that ground forward through tragedy and triumph and everything in between. A code was called halfway through her shift: multi-trauma, incoming, motorcycle versus truck on the interstate. The kind of case that would have fractured the team a year ago, that would have devolved into chaos and missed opportunities and preventable complications. But not now. The staff mobilized with precision, moving like a machine that had been fine-tuned through repetition and training and trust. The patient arrived unconscious, multiple fractures, internal bleeding, the kind of injuries that required perfect coordination to survive. Claire stepped into the trauma bay as they wheeled him in, her presence steady but not domineering, watching the team work. A nurse anticipated the need for blood before Cole called for it. A resident caught a subtle sign of cardiac tamponade that might have been missed before. A tech had the chest tube kit ready before anyone asked. They moved together, communicated clearly, made decisions with confidence built on training and experience and the knowledge that they were capable. They saved him. Afterward, standing outside the trauma bay while the patient was transferred to the ICU, Claire felt something she hadn't felt in a long time. Not pride, though there was some of that. Not satisfaction, though that was there too. Something quieter, deeper, more fundamental, purpose. She'd spent years fighting overseas, saving lives in impossible conditions, earning medals and commendations and the respect of people who understood what it meant to operate under fire. But she'd come home empty, unsure of who she was without the war, without the mission, without the structure that had defined her for so long. This hospital had tried to define her too, first as invisible, then as a problem, then as a threat, then as a hero. But she'd never been any of those things, not really. She was just someone who refused to let people give up on themselves, who saw potential where others saw nothing, who stepped forward when everyone else stepped back, who believed that the person society dismissed as just a nurse, or just a tech, or just whatever, could be extraordinary if someone gave them the chance. And that was enough. More than enough. Claire walked back to the nurse's station, picked up the next chart, started her next case. No fanfare, no cameras, no recognition beyond the quiet nod from Cole as he passed her in the hallway. Just the work. Because the most powerful thing you can be isn't the loudest voice in the room, or the person with the most credentials, or the one everyone looks to for answers. It's the person who shows up, who does the work, who refuses to let fear or doubt or dismissal stop them from being exactly who they are, who proves day after day, shift after shift, that quiet strength is the most dangerous kind because it can't be silenced or intimidated or broken. Claire Whitaker had been underestimated, buried, written off as just another nurse in a system designed to overlook people like her. And she'd proven that just another nurse could be the most dangerous thing in the world, not because of violence or revenge or destruction, but because she knew her worth even when no one else did. The hospital had learned. The staff had learned. The system had learned. But more importantly, the people who'd been invisible, the Angela Reeveses who'd felt small and overlooked and desperate, they'd learned that they didn't need permission to matter. Didn't need titles or recognition or validation from systems designed to overlook them. They just needed to believe in themselves long enough to prove everyone else wrong. And when they did, the world had no choice but to notice. Clare Whitaker wasn't a hero in the traditional sense. She hadn't charged into battle with guns blazing, hadn't given inspiring speeches or led dramatic rescues captured on camera. She was something better, something more essential. She was proof that the quiet ones, the overlooked ones, the ones dismissed and underestimated and told they weren't enough, they're the ones who change everything. Not because they're louder, but because they refuse to be silenced. And that kind of strength doesn't just save lives in emergency rooms or on battlefields. It reshapes the world, one quiet act of defiance at a time. One person stepping up when they're told to step back. One voice saying, "I matter," when the system insists they don't. That's the real power, not in the grand gestures or the dramatic moments, but in showing up every single day and refusing to be anything less than what you are, regardless of what anyone else thinks or says or does, and in teaching others to do the same. That's how you win. That's how you change things. That's how you prove that the most dangerous mistake anyone can make is underestimating someone who knows their own worth. Clare Whitaker knew hers, and Silverline General and everyone in it would never forget.